Chairman, just so you know, it was Councilmember Henderson, Councilmember Pinto, then Councilmember Che.
Thank you. You said
And you
Pinto
are all
was
set
first?
whenever you're ready.
Henderson, Pinto, Che.
Hi, Chairman.
Good afternoon, council member. All right, I'm going to start this hearing. I'm going to order this hearing or roundtable. This is a public roundtable of the Committee of the Whole of the Council of the District of Columbia. I'm Phil Mendelson, Chairman of the Council and Chair of the Committee of the Whole. Today is Monday, May 24th, 2021. The time is 12:09 in the afternoon. And this hearing or roundtable is being conducted virtually, being broadcast on the chairman's website, which is www.chairmanmendelson.com/live. We are broadcasting this on what we call the B track. This hearing is being streamed live on the committee's website, which is, as I said, www.chairmanmendelson.com/live. The hearing will be available on the council website and cable TV within a few days. Witnesses, there are 8 witnesses. I'm going to call them all in at once. There are, I believe, 3 council members who are here. I'll recognize them in a moment. So this is the first of 3 hearings we're having this week as a series related to the reopening of the district's public schools and the executive's plan for addressing student learning loss that has occurred during the COVID-19 pandemic. The purpose of this roundtable today is to receive testimony from invited experts about the proper IT needs for distance learning and on the strategies that the district should employ to assist parents in feeling comfortable about sending their children back to learning in person. Since the district's main strategy for combating learning loss is to resume in-person learning, it is vital that the district engage families and address vaccine hesitancy to accomplish this goal. Yet there will be some students who cannot return to in-person learning in the fall due to medical considerations. So it is important to ensure that those students have sufficient internet access. Because the committee is seeking testimony from the public in a separate roundtable, and this particular roundtable is to hear from certain experts. This roundtable has been limited to invited witnesses only. And the topics that we are looking to explore with this hearing today are technical aspects of internet needs, family engagement, vaccine hesitancy, and facilities, particularly in light of if there are restrictions with reopening, what are we doing to ensure that the facilities meet the needs for schools. As I said, this is the first of 3 hearings. The second hearing is Wednesday evening, 6 to 9 p.m., where we have specifically focused on inviting parents from families in Ward 7 and 8. And then on Friday, we will have the 3rd in our series of hearings, which will be government witnesses only. I don't have the list in front of me, but I believe it's DCPS, the Deputy Mayor, Office of State Superintendent for Education, and the Department of Behavioral Health. The advantage of Friday's hearing is that the budget will have been released on Thursday, and so we can hear more specifically strategies that the executive plans to pursue in the fall. I want to note that there is another education-related hearing this week on Wednesday. It's being held by the Special Committee on the COVID-19 recovery. And that hearing is looking at more generally recovery in our education in light of recovery. So there may be a little bit of overlap, but we're very specific with where we're going with these 3 hearings this week. And the Special Committee will be looking more generally at the issue of recovering from the pandemic in the education arena. The record in this matter will be open until June 11th. It will close at 5 p.m. on June 11th, 2021. Let me turn to colleagues if they have opening statements. And I don't want them to feel the pressure that they have to. Councilmember Henderson, do you have anything?
I do, Mr. Chairman. Thank you. Thank you to all of the experts for being here today. This past school year, our teachers and staff and students and families have been challenged in unimaginable ways and certainly deserve recognition and appreciation for the support that they've been providing our students so that they can be successful this school year. I'm pleased that you're holding this hearing today so that we can discuss some of the lessons learned as we prepare for our reopening plans for in-person learning in the fall. I'm not sure if these experts can get into it today, but also looking to know how DC has assessed this past school year and how we're thinking about making improvements. I hope we can learn about, preparations for facilities. I was just in contact with someone this morning about some of our elementary schools that are having some HVAC issues, even now with students in the building, as well as technological updates that are necessary to facilitate student, faculty, and staff safety. My staff and I were just talking about this morning that even though the plan is for 5 days of in-person instruction going into next school year, what happens if a young person or someone in their family contracts COVID over the school year and they have to quarantine or be out of class for a period of time? How can we ensure that each of our schools have the technology in place so they're not relegated to just worksheet packets, but can still actively participate in the educational experiencing that's happening in their particular schools? So hopefully some of our witnesses have some thoughts about that today. Again, thank you to everyone, and I look forward to the discussion.
Thank you, Councilmember. Councilmember Pinto, if you have an opening statement.
Thank you very much, Chairman Mendelson. I will be brief, but I'm thrilled that we're holding this roundtable today on school reopening and academic recovery, which is, of course, on all of our minds. It goes without saying that this has been an extremely difficult year and a year and a half for our families, students, teachers, and our school administrators. And I really want to add my thanks to our school leaders and teachers for determining how to switch an entire school district to virtual learning in a matter of days. I have heard so many unbelievable stories about teachers who have really gone above and beyond to deliver computers and school materials directly to students' homes, and who have demonstrated so much creativity and flexibility while adapting to online and hybrid learning to keep their students engaged. And I know that many became IT experts overnight while helping many students navigate connectivity challenges. Teachers should never have been put in this position, but I know that our students and families are grateful for the extreme lengths that they went to and are continuing to go to ensure our students receive an excellent education. But today, I'm looking forward to learning and hearing from our expert witnesses on how we can best support our students next year and to address the huge amounts of learning loss that we continue to see. I know families, students, and teachers are so eager to return in person to school in the fall, and that cannot come soon enough. This past year has shown how important it is to invest in our teachers and our schools. And while I'm grateful for Mayor Bowser's commitment to increase the at-risk weight and create new at-risk categories, not to cut teacher positions this next school year, we have much more to do to ensure that our staffing levels are supported and therefore our students are adequately supported. We have to invest in mental health clinicians and ensure that every school has a professional librarian, invest in high dosage tutoring and out-of-school programming. I'm committed to ensuring our schools have the funding they need in the fiscal year 2022 budget to best serve our students. So thank you very much, Chairman Mendelson.
Thank you, Councilmember Pinto. Councilmember Shea. I moved my notes.
Thank you, Mr. Chairman, and thank you very much for this hearing. We all know that it's been very, very hard over this last more than a year with the pandemic, and how heroic and effective our teachers have been under these very difficult circumstances, teachers and staff, and going above and beyond what we could have possibly imagined. But now that we're at this point, obviously nothing's more vital than ensuring that our students can have all that they need to recover from the harms of the pandemic, not just learning loss and trying to figure out what that is and how we can do that, but also the social and emotional harms our students no doubt have suffered during this period as well. So like you, Mr. Chairman, and my colleagues, I look forward to hearing from the experts to tell us how we get to the point of restoring our students, restoring our school system to what it was, and beyond that, to what it should be, because helping our students learn is probably the most important job that we have. So thank you, Mr. Chairman, and I look forward to hearing from the experts as well.
Thank you, Councilmember. All right, so let me welcome all of the witnesses at once. Bradley Chambers, who's an education network engineer. Darren Reed, who's Senior Vice President of School Services with Stride, Inc. Maya Martin Cottigan, who is Executive Director of PAVE. Dan Davis, who's the Chief Student Advocate with the Office of the Chief Student Advocate. Dr. Julia Wu, who is Principal Investigator, Human Immunomics Initiative, Harvard T.H. Chan School of Public Health. Dr. Seema Sagir, who is co-founder and CEO of Sergio Ventures. Reverend Kendrick Curry, who's Senior Pastor of the Pennsylvania Avenue Baptist Church, and Shannon Hodge, who's Executive Director of the DC Charter School Alliance. And we'll begin with Mr. Chambers. We have a clock, and on my gallery view, it's the top left. Ordinarily, I ask witnesses to stick to 4 minutes. I'm not going to do that to you unless you get to like 10 or 15 minutes. And but if you would be mindful of the time. So Mr. Chambers, you want to begin? And good afternoon, and thank you for being here.
Hey, thanks for having me. Just for introductions, my name is Bradley Chambers. I currently serve as the Director of IT for Brainerd Baptist School in Chattanooga, Tennessee. I've engineered K-12 Wi-Fi networks for the past decade, since 2009, so even longer, 12 years. I write about Apple and education and technology for 9to5Mac as well. 9to5Mac is one of the most popular Apple websites in the world. Like many schools, we had a lot of adjustments to make last year with going virtual, and learned a lot as well. And then this year we have been open for the entire school year except for one day. We've had students come in and out of virtual learning through quarantine. But we think we navigated that very well, and our school is getting back to normal, as I know many of you are hoping to as well. I think one thing that I want to reiterate with education is education had to do things that most businesses did not. So K-12 schools not only had figured out how to let their employees work from home, but they also had to prepare students to learn from home, and those are really different strategies. I think one of the challenges here for students is that Wi-Fi is just not enough for distance learning and remote work. Simply having a high-speed internet into the home or apartment is just half the solution. So if you say checkbox, every student has access to free internet, that doesn't mean that their connection is good. Wi-Fi must be throughout the home, wherever the people are. In many situations, the Wi-Fi router supplied by the high-speed internet company is on one end of the home, but a student is on the video call on the other end where the Wi-Fi doesn't reach as well. Wi-Fi is a distance-limited technology, so the further you get away from the router, the worse the connection is. And this is exacerbated by anything in walls, people. People are actually one of the biggest attenuators of RF signal, which is what Wi-Fi runs off of because of the water in our body. But again, concrete, brick walls, massive attenuation problems. Now, and video connections are also very unforgiving when it comes to spotty connections. We're loading a web page or sending an email can tolerate an unpredictable connection. Video does not. It kind of either works or it doesn't, and you're always well aware of that. Just as if my internet was flickering right now, I had a poor connection, I would be coming in and out, and you would know that. Device selection is also part of this as well. If a device only works on, say, 2.4 gigahertz, then it'll be much more prone to RF interference, and I'll cover that later, versus one that supports 5 gigahertz. Typically, many lower end devices only support 2.4 gigahertz. So one thing to consider for multi-dwelling units like apartments is if there are 15 or so Wi-Fi networks within range of each other, RF interference becomes a concern. It's what we in the industry call co-channel interference. It's where there is just RF waves over the top of each other. Providing free Wi-Fi is like providing roads. Just because the roads are there doesn't mean the traffic can get where it's going. 2.4 gigahertz specifically only has 3 channels that are non-overlapping. So it's channel 1, channel 6, and channel 11. So that means if there are 6 Wi-Fi connections on 2.4 gigahertz, which is very common in like a multi-dwelling unit, there's just massive interference problem. And there's really, you can't make the internet faster. Like there's nothing, say, Comcast or a Charter or Verizon can do in that situation. That is just interference from radio frequencies. So again, that comes back to the 2.4 versus 5 gigahertz. Now, again, I'm not saying that the problems that exist in virtual learning are interference problems, but I would venture to say the majority of them are going to come back to interference problems. So the question I've been asked a lot is, do all homes need the same coverage? Now, I think one of the things to consider is if there's a 25 meg internet connection to the home, 3 to 4 people in the home using video technology at the same time, it's very possible to saturate the connection, even under the best of circumstances. A 1080p video call can easily take 4 to 5 megs each. So you do the math, 4 people on there, 5, 6 megs a piece, multiplied out, you're at almost maximum bandwidth, and that's under the best of circumstances. My earlier comment above about RF interference in apartments and multi-dwelling units definitely applies here. Again, the more interference, the less capacity you're going to have. Now, I don't envy. Now, at our school, we have 300 students, and so we are obviously a much smaller district than you all are, but we have the same problems. It is really a hard problem to solve. I had a hard enough problem serving our families during virtual learning because there's only so much you can do on your end. Essentially, adding and supporting every single home internet connection is almost impossible. Like you wouldn't actually need a Comcast style call center set up to properly support every family to do it well. It's really unfair to ask district IT to go from supporting X number of schools to supporting every home and everybody's internet connection. But the unfortunate thing here is there's not an easy fix. Money is not the issue here. Spending money on Wi-Fi and internet speeds won't fix the problem, just like spending money at underperforming schools doesn't always fix the problem. When it comes to distance learning, making sure the home has fast internet, there's robust Wi-Fi in all areas of the home, or at least in the primary learning location, and again, that can be different in every single home, and limited RF interference will all be required. The problem is at each home, and is especially hard in apartments and multi-dwelling units. When there are issues, most parents don't feel skilled enough to troubleshoot the problem. And even if the problem isn't on the network side of the home, it could be on the vendor's end. So if you've got a Microsoft or a Zoom issue, if the schools are going to be required to implement and manage networks of students, there's going to be a massive rethought of a district technology strategy in terms of hiring, support, equipment needed. No school was prepared to do distance learning. And even with months notice now, I mean, you could even say, well, you knew in June we were going to be virtual. You would need the operation of a Comcast or a Charter or Verizon to support thousands of home networks. It's just not possible, even with the fastest internet. There are so many variables. So those are my prepared remarks. Happy to take questions.
Thank you, Mr. Chambers. So I'm going to go through all the witnesses and then see if there are questions.
Okay.
Reed?
Of course, I was muted, sorry. Thank you, Mr. Chairman and members of the committee. I'm Darren Reed, Senior Vice President of School Services at Stride, Inc. I'm a lifelong educator, served in a variety of teaching and leadership roles in public, private, and online schools. Here in my role at Stride, I oversee all of our school partnerships across the northern and eastern region of the United States, including the district. Stride is the nation's largest provider of online learning for grades K through 12. Our company provides high quality online learning opportunities for students, schools, districts, including general education, electives, and career learning. Since 2000, Stride, formerly known as K-12 Inc., has served over 1 million students in public and private schools across the nation and throughout the world. Currently, we serve nearly 200,000 students in full-time online public schools in over 30 states, including the district. We also work with the largest network of online teachers in the U.S., providing professional development, training, and support to help educators excel in the virtual classroom. In the District of Columbia, Stride works in partnership with Friendship Public Charter School to offer a high-quality, full-time online school program. Friendship Online Academy is DC's only award-winning, fully virtual elementary and middle school. The school is available to all students in DC, tuition-free, of course, providing equal access and opportunity for all students, regardless of race, gender, academic need, or social economic status. Our company is headquartered here in Northern Virginia and are extremely proud of our longtime partnership with Friendship and the opportunity to serve students, parents, and educators in DC. You know, one of the great attributes of online school is the ability to reach students from all corners of a particular city or state. Online schools are often the only public school alternatives students can access outside their locally assigned school. And for some students, especially those with medical, social, emotional, or special ed needs that can't be met in the traditional classroom, online schools are a critically important public school option. Stride-powered online schools provide equal access and opportunity to students regardless of geographic location. Statewide full-time online schools are unique in that they are often the only school that students have, the only schools to have students in urban, suburban, and rural communities enrolled in the same school. Stride-powered schools generally reflect the demographic of a particular state or city as a whole, but with one exception. We often find that we serve a significantly higher population of economically disadvantaged students than state averages. But in an online school, equity of opportunity requires equity of access, specifically around access to technology. This is a significant challenge and one that we have worked with our partners to address directly. Rather than bringing students to school, we bring school to students. And in the traditional model, transportation to the school building is essential. And in our model, technology access is essential. Internet is to online schools what school buses are to brick and mortar. And this is why Stride has worked so hard to help close the technology gap known as the digital divide. And here's what we do. Stride works with our school partners to provide students computers, reimbursements to cover home internet costs. And many of our client schools, economically disadvantaged students receive internet subsidies and free computers. In some states, all families are eligible to receive at least partial reimbursement for home internet. And reimbursements amounts vary by school, primarily based on state funding. But as the speed and quality of internet connectivity increases, so do the costs. And as more and more devices in homes are connected to Wi-Fi, there's greater demand for better, faster, and higher cost internet service. Also, as an online provider like Stride continues to develop more innovative, engaging online curriculum and instruction, the need for faster speed internet increases as well. The same is true for traditional schools, especially as more schools require students to access online learning platforms from home to complete homework or long-term assignments. The barrier is just not around connectivity, but cost as well because of limited state funding. And I think it's important to note that full-time online schools are often funded significantly less than traditional schools. These partial internet reimbursements are often borne directly by our company to help families cover these costs. We do this because of our commitment to ensure equity of access. States often provide many categorical education funds, but not to cover home internet costs for public school students, even for educational purposes. We're extremely proud of how we've helped close that gap by shipping computers to hundreds of thousands of students, many of whom never had a computer in their home before enrolling, and helping lower home internet costs. But the burden to achieve educational access cannot fall solely on the backs of education service providers or schools that already operate with scarce funding. After all, schools can't lay broadband cable or launch satellites, nor should they be mandated to fully cover the ever-rising cost of home internet for every student with additional funding. This is why Stride made internet access its center pillar in our educational equity policy goals. Our executive chairman of the board, Nate Davis, said it clearly: high-speed internet access for all is fundamental to America's infrastructure. It involves investing in new technologies to ensure access for all, regardless of geographic location, and allocating additional resources to ensure families, especially low-income families, that they have the resources needed to connect to internet at home so education can be provided to them directly and reliably every day. Through our partnership, Stride is helping to close this technology gap for economically disadvantaged families in DC and across the nation, delivering innovative education opportunities for families. More needs to be done to fully eliminate this divide, but Stride stands prepared to help. Thank you.
Thank you, Mr. Reed. And again, we'll have questions at the end. Ms. Cardigan.
Thank you so much, Chairman Mendelson, and to all the members of the Committee of the Whole. My name is Maya Martin Cadogan, and I serve as the Executive Director of PAVE. Thank you for the invitation to testify today. I want to start just by sharing that all of what I'm offering here is based on the conversations that we've had with our parent leaders at PAVE, and they don't represent the views of every family in DC. The parent leaders of PAVE are diverse in their views, lived experiences, and perspectives, just like the parents of DC. They're Black, white, Latino, and Asian. They're Native Washingtonians and residents who are new to our 4 quadrants. They're in 6-figure households, and they are in households that our system has kept farthest from economic opportunity. They own their homes, and they feel the struggles of transients in our rapidly gentrifying communities. They're excited for a return to in-person learning, and they are wary of what that means given the history of inequity in our schools. And while my testimony will be an attempt to aggregate what we've heard from each of them in our monthly board meetings and testimonies and in one-to-ones with our team, they are just some of the voices that should be represented in our work to provide each child in DC an excellent education. You will hear from those PAVE parent leaders about their vision for DC schools recovery, which includes a safe and equitable reopening, and hearings this week and next, and I urge you to listen to them. Too often, the people who are closest to the pain of not only DC's, but our federal government's policy decisions are furthest from these rooms of power. And our system would be stronger if we did a better job of not just creating space for them to share, but going to them, which I do want to thank Chairman Mendelson and his staff for doing in March. I hope that every council member on this body who is making decisions for families will do the same and do so regularly. All of that said, I will use my time today to lift up the concerns we've heard from families and the solutions that system leaders and DC Council can take to make that vision a reality. So in terms of parent concerns about return to school in person, the first is really around poor communication. Despite the relaxed health guidance stemming from the availability and effectiveness of vaccines and lower COVID rates, hesitation remains for many families, especially Black and Brown families. In many cases, schools have evolved into a place of fear as a result of mixed messages about what is versus what is not safe. This increased fear has also been a result of the lack of clear communication about changes in health guidance, why those changes take place, and what investments and action steps will be taken to ensure ongoing safety. There's a lack of trust. Overall, too many parents have felt that school was not working for their family even before the pandemic. This has especially been true for families of children with disabilities and Black and Brown families who often feel that the system has overpromised and underdelivered and presented incomplete information to them in their communities. Without clear plans and communication about what will be improved or changed, parents do not trust that the system will get their kids and their families the resources, support, and education they need and deserve, especially in light of health concerns. There's also hesitancy based on child age and grade level. We've heard from many early childhood parent leaders at PAVE that they are more ready to return in person, citing the importance of socialization with peers at a pivotal developmental moment. However, we also know that overall applications for pre-K3 and pre-K4 are significantly down this year, 1,298 applications in pre-K3 and 529 in pre-K4. DC saw major gains from the expansion to universal early childhood, especially not only increasing language fluency that carried over into our later grades, but also for women's workforce participation of all ages, races, and socioeconomic backgrounds. We risk going backwards if we do not begin to target engagement with families to increase participation. Additionally, despite voiced concerns about college and career readiness during virtual learning, we've heard from Black and Brown parents of high school kids and the students themselves that they are often more hesitant to have their student return to in-person learning. We also have disparate impacts east of the river. Many families that have been furthest from opportunity and most impacted by the pandemic, in particular those in Ward 7 and 8, have expressed the greatest hesitancy to return to school in person. This largely stems from outsized COVID rates of cases and deaths in their communities, often having less access to resources like healthcare, food, or OST, out of school time programs, stable housing, and deeper mistrust of the system as a result of historic injustice and discrimination. We also have unclear processes for exemptions for in-person learning. After learning about the medical exemption requirement for DCPS schools and many charters moving to all in-person models, some parents were upset that they would not be given the option, even if they themselves are comfortable with sending their kids to school. Currently, there is no definition of which medical certifications would make a student eligible to learn remotely. The lack of clear communication and process for families to navigate further fuels confusion, frustration, and mistrust. We also have a lack of access to 21st century learning. The pandemic made internet at home a necessity that the system had to respond to for students and their families. But in the 21st century, equity of high-speed access should have been and should be a given, and not just because we're responding to an emergency. While Comcast Internet Essentials and other free and low-cost options have been helpful, they are insufficient. Often providers are throttling multiple households together, and even high school students up I-95 in Baltimore have highlighted that these services don't provide the bandwidth necessary for online classes, platforms, and assessments. So the question is, what can DC leaders do? It's really about developing a clear, comprehensive guidance for health and safety centered in kids and families. Parents are looking for systems in schools to effectively share clear plans based on ongoing updates in the CDC and the Department of Health. Much of the reopening plans and subsequent guidance has been centered on single adults, i.e. reopening of bars, restaurants, gyms. We must put that same emphasis on kids and families and on the supports they need and deserve, like schools, OST programs, and childcare, and how to rebuild a healthy and strong community. Transportation is key and has been a key concern for many families, and not only due to COVID. Many fear their children may witness or experience violence on their way to and from school. And in a system of choice, especially for families east of the river, travel time can be over an hour each way to and from schools. LEAs must work closely together with other government agencies and community providers to provide safe, accessible transportation options to school. Families need clear and consistent communication about updates to school buildings, as Councilmember Henderson mentioned, particularly around HVAC systems, windows, bathrooms, and other essential components for a safe return. While DC has made significant updates to school buildings, many parents have not been made aware, and therefore their concerns and questions remain. Concerns about school and program facilities existed long before the pandemic, so trust has already been eroded. Information sharing about this needs to be much stronger as we look ahead to reopen full-time in the fall. Parents are also calling for schools to more meaningfully incorporate mental health and social-emotional learning into their reopening plans. All students have faced unprecedented trauma, and many students have not been in a school building in over a year. School leaders must reimagine their school culture that includes planning for a trauma-informed welcome back to school with age-appropriate plans to reintroduce students back into the building and school routines. Many parents felt that school culture and mental health support weren't done well before the pandemic. So it's important that with their increasing concerns to return to school full-time, that we address that when the stakes are much higher. And we need to ensure that we fully fund all necessary resources and supports. We can only ensure all this work is possible by fully funding our education system, the kids of all ages at all hours of the day at school and at home. This includes fully funding the UPSFF, at-risk weight, mental health supports in schools and in communities, OST programs, and childcare. And it also includes addressing digital equity needs like those that the council proposed to the Internet Equity Amendment Act, and organizations like New York City's Industrial Areas Foundation are pushing through high-speed mesh Wi-Fi networks and low-income housing developments. With additional funding, schools and childcare centers can scaffold and incentivize opportunities to engage in person and build or rebuild relationships. That includes using the last few weeks of the school year and summer as stepping stones to get families prepared and comfortable for fall, expanding OST programs, especially program deserts in wards 5, 7, and 8, offering materials and food for learning and bringing other resources to families who are looking for like mobile vaccinations and physicals. And education lies at the intersection of many different issues. We need coordinated, equity-centered investments to support kids and families' basic needs. We must invest in food, housing, utility, internet, healthcare, and violence prevention so every family can thrive. In some, our elected officials were chosen by the people of DC to listen, lead, and hold the system accountable. Now is an opportunity to show that we as DC prioritize our children and the voices and experiences of families in order to create a brighter future for every Washingtonian. Thank you so much again for the opportunity to testify today.
Thank you, Ms. Cardugan. Dan Davis?
Good afternoon, Chairman Mendelson, staff. My name is Dan Davis, and I lead the work of the Office of the Student Advocate as Chief Student Advocate. Our office supports and guides families with concerns through a system of public education in the district. Every day we work to ensure that our family and student voice stays at the center of our system of public education. I'm honored to share with you today concerns brought to our office from students and families across the district. The past 2 years prove that our school leaders and teachers are wonderfully creative and capable of transformation. Our students and families have proved over and over that they are resilient and committed to be partners in education. As we move to a return to the classroom, we cannot change the role of students and families in education from partners to followers. We must make certain that the framework for returning to school is a shared decision model between families and school leaders. Throughout the transition to distance learning, the ongoing efforts to recover, and this summer's push to combat learning loss, we ask students and families to use faith again and again that their children's best interests will be served without their input. We now ask families to return to school buildings that for many did not fully meet their needs prior to the pandemic. The most pressing concerns we hear come from families at both traditional schools and charter campuses is that students with special needs struggle to not only keep pace with their peers, but have lost progress made before the pivot to distance learning. These families for the past 2 years have met with school leaders, instructors, and service providers, desperately seeking any and every path forward. These families need recovery that accounts for the loss of progress during distance learning and accelerates their students to make progress at the rate their peers will be post-recovery. Moreover, families seek proactive engagement and transparency with what is occurring. We hear continuously from families that a school is not willing to meet the request of families asking, particularly with screening and evaluation and revisiting current accommodations. For some, as we lead them through the process of speaking with the school and problem solving with their concerns, we find 2 things. That 1, the school is aware of the concern and has been working to troubleshoot the solution at the classroom level, but did not communicate directly with the family. Or 2, the school had not communicated with the family where they are in the process of addressing the issue and the steps they plan to take such as responses like small group instructions or other interventions. In more than a few instances, once the school and family are able to get on the same page, we see an increased willingness for them to work together to improve outcomes. Unfortunately, for some families, some families find answers that solutions they seek aren't available right now and must wait. Likewise, all students and families across sectors throughout the district need improved communication with their school buildings. The dialogue between school and families on how we return to school, our priorities, and the framework to school in the fall cannot be reserved for those who have the access and privilege to be vocal and present. This period of distance learning compelled us to take a more intentional community-centered approach to family involvement. We saw schools create new avenues for frequent check-ins with families and problem solving. As we move forward, it's critical we ensure that our engagement with families restores confidence in our school systems and prioritize families' voice in decisions made by leadership. We know that every parent and guardian holds essential expertise about their child, and as schools build out recovery learning plans, they should be grounded in that key experience. Furthermore, there are communication challenges within our current efforts that students and families are unsure about. Grading policies and their effect of neutral GPA credits on transcripts, their impact on admissions to selective high schools and college admissions, students and staff vaccination requirements and their rollout, eligibility for summer programming, in-person offering, and start dates, options for families who don't want to vaccinate their children and are not ready to send their children back to school just yet, and options for families who feel virtual learning has benefited their child. Improved communication at the school level between building leaders and families is a start, but there are concerns from students and families that are shared with school leadership. One in particular is how we transport students to and from school. Now is the time to listen to students, family, and school leaders about what can improve the daily commute between home and school. We struggled in many areas with students' use of public transportation before the pandemic. Bus capacity during peak travel times, behavior and safety concerns aboard rail, and ultimately timeliness. Ensuring students on time arrive to school safely as we begin to use public transportation again must be present and clearly communicated in our reopening plans. We cannot find complacency in believing that we've made it to this point by our own efforts. Our teachers have played arguably the most crucial role supporting students in this time. However, their voices are consistently missing from this decision-making process. The trust students and families have with school is earned in the classroom, and it is a product of so many talented talented and dedicated educators. Returning to the classroom must have buy-in from our teachers so that families can have confidence that school buildings are safe learning environments. Our teachers have proven time and time again that they are devoted to this work and willing to do what is necessary to ensure the success of our students. Aside from families, our teachers spend the most time with students and are another central source of expertise. In planning our path forward, teachers' voice must be encouraged and accepted throughout the process. Finally, if there are other questions or anyone interested in contacting our office, they can do so by calling us at 207-741-4692. Thank you for the opportunity to testify, and I welcome any questions you might have.
Thank you, Mr. Davis. Dr. Wu.
Sorry, I was muted. Thank you, Chairman Mendelson. Thank you, our council members. Thank you for the opportunity to testify on this important topic of vaccine hesitancy and the school reopening. My name is Julia Wu. I am an infectious disease epidemiologist at Harvard T.H. Chan School Public Health. I will start by reviewing vaccine hesitancy and its roots, then offer 3 principal approaches to address it, followed by 3 recommendations considering the specific context of school reopening in the District of Columbia. Vaccine hesitancy is a multifaceted phenomenon that is associated with fears and doubts on the risk-benefit of vaccines in terms of effectiveness and safety concerns. This is in particular related to new vaccines. Risk perception of both the disease threats and the vaccine has always been embedded in historical social cultural contexts. Furthermore, vaccine confidence reflects a set of relationships with individuals as part of a community decision. Our research has found that there is wide geographic variation in COVID-19 vaccine acceptance. Key attributes have shaped differential profiles in different subgroups. Among them, public trust plays a central role determining the vaccine acceptance. In general, marginalized subgroups are most vulnerable in terms of COVID-19 vaccine hesitancy. The findings of lower COVID-19 vaccine acceptance among Black Americans are alarming, but not surprising. From the Tuskegee study to the Mississippi Pediatric Academy, the US medical establishment has a long history of experimenting on people of color without their consent. Distrust of a new COVID-19 vaccine is not anti-science necessary, but rather based on history and personal experience. Vaccine hesitancy among people of color therefore requires targeted approaches to rebuild the trust. Here I offer 3 principal approaches. First, a trusted alliance needs to be formed in order to engage with the communities and to reduce safety concerns. Ideally, it should be led by trusted public health professionals with government officials, media, and other prominent community leaders taking supportive roles. Non-traditional partners with high trust levels need to be integral parts of the team. Listening and emphasizing communities' concerns will be a big part of the dialogue when providing clear and consistent messaging about vaccine safety. Focus group can be a powerful way of hearing communities' concerns. Accessible languages will be helpful on how COVID vaccines are being developed, what safety measures are in place, and what thresholds of safety need to be met before vaccines are approved. Vaccination should be framed as a tool to bring justice and benefits to communities of color. Second, peer influence is an important game changer to build a pro-vaccine social norm in communities of color. Community messengers, including pastors, teachers, community organizers, and local elected officials, can help lead by example by talking about their own plans to get vaccinated and encouraging the people that they encounter to do the same through ongoing dialogues. Collaboration with local social media platforms and influencers for research on online communities and strategies are especially of importance. Third, combating the distrust with historical roots requires policymakers' mindsets that are not narrowly focused on the current vaccine hesitancy problem at hand. An effective way of rebuilding the trust, especially among the most heavily hit communities, is to prioritize expanding healthcare access and invest in improvements of quality of life, education, jobs, and a family. And to implement these approaches, given the specific school reopening context in District of Columbia, here are some recommendations. First, vast majority of residents in DC need to get vaccinated to bring an end to the virus transmission and make school reopening as safe as possible. We learn from infectious disease transmission dynamics that even with an overall high vaccination coverage, pockets of low vaccination will result in spreading of the virus. It is thus urgent to make a targeted effort to increase vaccine coverage among communities of color. Second, school system should not and cannot be the sole player to carry this responsibility. A concerted effort by designated task force is therefore needed to coordinate an alliance and to engage all parties, including media, schools, grassroots organizations, and non-traditional partners, community efforts that build on relationships with community leaders and equity infrastructure can fill an outreach void. Experiences from other jurisdictions includes work by the Michigan Health and Human Services Department, which has made partnerships across the state to understand the needs of all communities and all diverse Black communities. Another example is a Florida statewide COVID-19 vaccine community engagement task force, which comprises Black higher education representatives, business owners, media representatives, and politicians. Third, resource mobilization is required to make a concerted effort feasible to support the coordination, training, research, and community engagement. Funding mechanisms such as timely grant awards can make a quick difference. In summary, the speediness of school reopening and academic recovery will be largely determined by the speed of vaccination, especially among the most vulnerable communities. There is an urgent need for a concerted target effort to improve vaccine acceptance among communities with higher vaccine hesitancy. By prioritizing a coordinated effort, improving vaccine coverage among these communities, school reopening and academic recovery process can be made safer, steadier, and faster. I thank you very much for listening to my testimony. Thank you.
Thank you, Dr. Wu. Dr. Seema Seghare.
Great. Good afternoon, Chairman Mendelson and members of the committee. Thank you for the opportunity to address you today. My name is Seema Seghare. I'm co-founder and CEO of Surgo Ventures. We are a nonprofit dedicating to solving health problems with precision. As mentioned previously, I'm also adjunct assistant professor at the Harvard T.H. Chan School of Public Health. And finally, I'm a very proud DC resident. I am here to testify about Surgo Ventures' work to increase vaccine uptake, building greater confidence in the US. I do want to start by saying that people are more complicated than their race, gender, political party, or zip code. These things can help us identify who to target in our vaccine uptake campaigns, but they don't help us with how. How should we do that? So to move the needle, we really need to look at all of the psychological as well as the structural barriers that truly drive a person's intention as well as ability to getting vaccinated. So what I do want to stress that it's not just about hesitancy, as you probably all know, but there are significant access and time barriers, and each person is different, and we need to really understand each person's difference. So simply put, we believe that we need to treat the vaccination campaign as a marketing challenge and use the same playbook that businesses use to really get high levels of product uptake. We need to treat people as customers. We need to listen to their concerns and make it easy for them to get the vaccine. And so last week, Surgo Ventures released the results of the largest national survey in the United States, looking into COVID vaccine uptake. This was with 18,000 people, and this was done in close partnership with Facebook. Our survey measured the barriers standing in the way for why people are still not getting vaccinated. And what's interesting is that in our survey, we found that there are actually 5 types of people in the United States based on how they relate to the COVID vaccine. The first one are the enthusiasts. These are people who are ready to get vaccinated. These are the majority of people who already got vaccinated. The second is what we call the watchful. These are people who want to wait and see, given their confidence in vaccine safety and effectiveness. Third group are what we call the cost anxious. These folks, while the majority actually have health insurance, they are concerned about the financial as well as the time cost of getting the vaccine. And we know that the vaccine is free. And then the fourth group is what we call the system distrusters. Again, for very legitimate reasons, historic reasons, these folks believe that their race are treated unfairly by the US healthcare system. But I do want to stress that also this is not only Black and brown people, there are people of all races and ethnicities in this group. And then finally, we have a fifth group, which we call the COVID skeptics. These are people who believe COVID is low risk, and then they believe in several conspiracy theories. We looked closely how these personas break actually across the 50 states as well as the Washington, D.C. And what we found is patchwork distribution of these 5 types of people. One of the things that I also want to stress, which I did before, is that across these 5 groups, we find people of all races, of all political affiliations, and different education. So it's not just about race, age, gender, political affiliation. So how does it look like in Washington, D.C.? In D.C., 17% of the adult population fall into a group that we call system distrusters. Another 10% of the adult population fall into the group called the watchful, and then another 9% fall into the cost anxious. Then we have 4%, which is a low number, which is great, fall into the group of the COVID skeptics, and then 7% into the enthusiasts. And then all the remaining adults have already been vaccinated. So what does that tell us about DC? What it tells us is that, we can prioritize these groups that are at the top, right? The watchful, the system distrusters, and the cost anxious, to make sure that we can get the majority of the DC residents, adults vaccinated, and to make sure that we can get our children to school. So we also found that DC residents, when we asked in our survey, anticipate, those that have not gotten vaccinated, anticipate certain types of barriers. One that's really interesting is that 28% of DC residents told us that they think it would be hard for them to travel to a vaccination site. So this is an important barrier that needs to be solved. So what can we do? Well, we can address people's specific vaccine barriers with solutions that are drawn from behavioral science, communication campaigns, and structural approaches. Given the priority personas that we identified, here are some ideas. So one is use familiar locations. What are these? Barbershops, beauty salons, churches, trusted community messengers like barbers, stylists, and clergy to spur conversation about the benefits of vaccination are critical. I do want to highlight one of our partners at the University of Maryland Center for Health Equity, Health Advocates in Reach and Research Program is a great example of how we can actually train barbershops and stylists to be health educators. And this is a fantastic way to use our community members. We also need to make getting the vaccine highly visible. As I said, there are a group of people which are called the watchful, which are at the top, and they want to see more and more people getting vaccinated. So how can we make this more visible? How can we show the campaigns and show the numbers in social media and all of the other outlets? Obviously, we have a high number of cost anxious, so we need to support employers to provide vaccines on site and perhaps even at schools, and give them time off for the vaccination for both doses, as well as if they need to take time off because they are experiencing certain reactions. We need to also experiment with different models. And I know that DC is extremely innovative in this way in terms of how can we bring the vaccine to the people. So that means making it available in grocery stores, bars, convenient places, workplaces, wherever we can. And then finally, we really need to hold, and I know that this is also happening, door-to-door campaigns, listening sessions to really understand the distress that is there within the community, to respond, to listen, acknowledge, and respond. Above all, the solutions must be comprehensive and localized. I can't stress enough the localization. We know that human behavior is highly context-driven, and the best solutions are the tailored ones, drawing both on the wisdom of the community and the data that we have on that locality. Prioritizing vaccine solutions simply based not simply on demographics, but focused explicitly on the barriers and beliefs will help us get the majority of the district vaccinated and will help our families and our children, I should say, back to school. So thank you so much for your time and consideration. I look forward to answering any questions you may have.
Thank you, Dr. Sugair. Reverend Curry.
Chairman Mendelson and the committee of the whole, I'm Reverend Kendrick Curry, pastor of the Pennsylvania Avenue Baptist Church and Ward 7 resident. And I am so honored to be with you today to testify on this hearing at Returning to Schools and Academic Recovery. Let me just start by saying that public schools stand as one of the primary means of supporting our children, especially those that find themselves on the margins. And helping to achieve their fullest potential is one of the things public schools do. But the promise of support is threatened in terms of schools in this unprecedented post-pandemic school year. With the classroom instruction and the return to classroom instruction, students who are furthest from opportunity face a new set of obstacles to the promise of a high-quality education. They face barriers which at a minimum include learning loss, mental health challenges to include depression, anxiety, brain fog, memory loss, etc., and other unknown effects of long COVID. These obstacles further are complicated by racial and education inequality and inequity, as well as health misinformation and post-pandemic reentry hesitancy. So if DC and if we are to successfully return to school and begin the road to academic recovery, there are several things we must do. First, we must seek to rebuild trust. After a year of shared trauma, many have understandable social phobia and fear of returning to schools. We should engage parents, students, community organizations now to openly discuss their concerns about returning to school. Then this summer, we should reopen schools, provide tours and programming for parents, students, community partners to reacclimate them to being in school. And so that they can see for themselves that schools are safe and that their concerns are really being addressed. Parents seem to be more comfortable with people and places of trust and familiarity. As you know, we have found hosting COVID-19 testing and vaccination sites, which at our church, both a place of familiarity and trust that builds confidence and trust. We found that when we help and aid with transportation, when we think through those particular issues, working with federally qualified health centers and systematically pulling together how we can deal with the distribution network for a vaccine, we found that hosting at a place like a church with trusted, those who are trusted in the community find themselves being able to go to a community and allow us to move forward and tell the people who it is that they can trust. We use a trusted messenger or credible messenger type program. And that trusted messenger or credible messenger type program allows us to have voice with community partners that allay angst and allow us to have and build confidence as well as trust. Another thing that should be done is district schools must think about supporting students and family when they return in the fall. And not only this fall, but several years into the future. The job isn't over when students arrive day one. We have not only got to have the children who are in school in the fall, but we also have to make sure that students and families have the resources and support that they need so that they can thrive next year and in the succeeding years. Also, thirdly, we must look at schools should support and trusted institutions like schools so that they can deliver vaccines. We're advocating that schools should be vaccine distribution centers. Schools and educators are trusted, valued leaders in the community. Leveraging the trust that we already have along with the convenience, could boost vaccine confidence and help vaccines get into harder reach populations. As I've already noted, what we've seen in working with the church is to be able to assemble a network that allows us to go from DC Health through a federally qualified health center into a vaccine administrator that then allows us to have stationary sites where we can have mobile opportunities of transforming or transferring folk to and from the location at the church, a familiar place of worship. And then what we can do is watch how hesitancy is minimized. And we also see how we can build trust within the context of community. The last thing I would like to say is that as we move forward, the council should perhaps consider how we prioritize budgeting. We need more of those who are dealing with mental health, more mental health dollars in our schools, more long COVID supports. How do we deal with academic supports and look at going further to include the transportation that are also going to be needed to and from school, as well as closing the digital divide with the necessary resources there? We also need a renewed focus on social emotional growth. The social awkwardness that we've experienced by not being in contact with each other needs to be contended with and also considered as we deal with returning back to school. And what do we do about extending perhaps the school day and year for additional learning to overcome perhaps the learning loss? We've already heard about restoring enrichment activities before, during, and after school. And there's a great need of providing college and career counseling, tutoring, and mentorship to ensure that students remain on track and are successful toward graduation. I want to say that public education is a foundation of our collective civility, the keystone of our democratic ideals, and the principle of our aspirations for a more equitable society. If we are to see district schools thrive, we must appeal to our collective civility, democratic ideals, and aspirations of societal equity by engaging the community, opening schools this summer, vaccinating families in schools, partnering with community centers, and honoring the budgetary legacy that I've so outlined. When we do these things, perhaps we shall see families flourish like never before in the post-pandemic era as we talk about school entry. Thank you so much for allowing me to testify, and we will be happy to share with you in more detail with questions during the question period.
Thank you, Reverend Curry. Shannon Hodge.
Good afternoon, Chairman Mendelson and members of the committee. My name is Shannon Hodge, and I'm the founding executive director of the DC Charter School Alliance, the local nonprofit that advocates on behalf of public charter schools to ensure that all students in the district receive the great public education they deserve. Thank you for inviting me here today to discuss the challenges school leaders are facing with adequate and affordable facilities access on our road to educational recovery and the acceleration of student progress. From the very early days of the pandemic, public charter school leaders have struggled on multiple fronts with regards to coordination with and communication from city agencies about changes that will affect their operations. While our member schools are appreciative of the regular coordination calls hosted by the DME, as leaders have identified coordination barriers, instead of having systemic barriers addressed, they have largely been advised to individually outreach to city agencies for guidance. When school leaders have attempted to obtain information directly from various city agencies as directed by DME, those agencies have often been unresponsive or resistant to coordinating with individual charter schools. A simple adjustment of better coordination and communication would enable school leaders to adjust plans and operations within their school communities. Since November, charter school leaders have repeatedly laid out what schools need from city officials to enable them to safely bring more students back to school buildings for in-person learning. One key barrier is the lack of clear, updated public health guidance from DC Health, as federal and district guidelines have rapidly shifted, particularly as COVID vaccines are becoming more widely available. even as we have shared frustrations with the city on the problems within the existing guidance, including the need to clarify certain aspects that schools need to operate. DC Health has instead told school leaders that public health guidance should be treated as optional. School leaders need clear directives about what is required to safely operate in-person learning and what is not. Safe facilities and sufficient square footage for expanding in-person learning opportunities for students are more important now than ever. That means that some of our schools will need additional space to accommodate more students. To address these issues, some of our schools would benefit from partnering with nearby recreation centers or libraries. But DME must be in charge of setting up these partnerships with the Department of Parks and Recreation, instead of individual schools attempting to do so without the assistance of a citywide coordinated approach. Other schools have outdoor space that could be leveraged for additional classrooms by erecting outdoor structures or using trailers. But many schools have reported that the city is requiring permits for both, and that the permitting process is likely to take more than 6 months. An efficient, cost-effective solution to this problem is simply for the city to expedite the permitting process. Finally, other schools don't have the benefit of a nearby facility or outdoor areas that could be leveraged for additional classroom space. But if the health guidance on physical distancing rules are required and not optional, they need more space. As we continue to expand our in-person offerings to students, we must ensure our school buildings are safe and well-maintained. In DC, space is a premium. Managing facilities is costly, and the need to lease extra space to follow distancing guidelines for students and staff is a significant investment. According to a survey the DC Alliance conducted on facilities needs, completed by nearly 2/3 of charter schools leaders, 70% of leaders, that's 70% of leaders reported increasing facilities costs during the pandemic, and those costs are rising. According to the Bureau of Labor Statistics, the cost of constructing new school buildings has risen by an average of 3.1% each year from 2016 to 2020. And thanks to rising construction and materials costs from a surge in activity during the pandemic, minor improvements and maintenance costs have gone up significantly. In that same survey, 2 out of every 3 school leaders reported that they anticipated increases in their facilities costs, ranging from 2% to more than 10% next year. Only 5% of respondents said they didn't anticipate any increases. Schools have already invested thousands of dollars this year to ensure buildings can support in-person learning this spring and next school year. But the current facilities allotment is not sufficient to cover cost. More than half of charter school leaders are unable to cover all facilities costs with charter facilities funding at the current allotment level. That's why the next budget must increase the facilities allotment for charter schools by 3.1% to mirror the average of new school construction cost. Nearly 60% of surveyed respondents expressed that there would be a significant or very significant impact on student and staff safety and reopening needs if they didn't receive a facilities allotment increase next school year. One leader reported that unless the city makes a commitment to fund facilities at a more realistic amount, over time, more and more of our UPSFF will need to be redirected away from direct student services and teacher salaries in order to afford our rent. Consistent funding of our facilities is key for both budget predictability for school leaders and for providing a safe learning environment for our students. For that reason, charter school facilities must be included as a priority in the budget. Thank you for your time and attention to this matter, and I welcome your questions.
Thank you, Ms. Hodge. Thank you, each of you, for your testimony. Because there are several other council members here, we'll be on a 10-minute clock for questions. And I also understand, I got a message that Dr. Seghire, you have to leave at about 1:30.
Yeah, my apologies, yes.
So maybe what I'll do actually is ask some questions about vaccine hesitancy, and then turn to my colleagues, and then we'll go back to 10-minute rounds. So I was hoping for an easy explanation on what to do about vaccine hesitancy. And the impression I got from listening to the testimony is that it's more complex. There's not a simple answer, and that it's just a lot more work. We are trying to do things in the district. For instance, Reverend Curry is one of the witnesses because I believe he, through his church, has been doing outreach to try to increase vaccine uptake. But his church is located in Ward 7. And my recollection is that as of last week, fully vaccinated was less than 20% in Ward 7 and 8. So there's really quite a challenge there. I'm not leading to a question, and that's not good. Mr. Curry, with regard to the hesitancy, Reverend Curry, what should we be doing differently since you're in the thick of it?
So I thank you, Chair Mendelson. One of the things we are looking at is really having more stationary sites. As you know, we've multiplied the number of locations throughout the district with regard to placement of sites. One of the things we have to consider are those places of familiarity. There's one house of worship in the Latinx community that is a very central culturally to the community itself. And in doing testing and vaccination at that location, we had more people show up because they trusted the priest and the credible messengers who were there to be able to say that I will take the vaccine. Likewise, at my house of worship, when we've had stationary location and time there, we've also said, Pastor, because you're taking it and you live in the community as well, we're also are willing to take the vaccine. So what I've worked out and what we've done with the Department of Health through the great program, Faith in the Vaccine, is we're looking at a variety of different things, from stationary sites to mobile sites, and those who know the community. I mean, actually can walk in and talk to various folk in the community are going in with, so that we will be able to get more and more folk vaccinated. And I will close that by saying this. We found also that the more of the young people and the athletes and the other credible messengers that the young people respect and adore, the number of younger persons that are under the age of 30 would be able to better have, well, not only have we solved the access issue, but they would be better and more willing to accept the vaccine because it's someone they trust. This has gotten down to a one-on-one personal sort of relationship. And it's really based on who you know and how much you trust. And now there are challenges within families. I have families personally in our own congregation who, quite frankly, have one member vaccinated, other members who are not. And we've heard excellent testimony regarding why that could be and what categories they may find themselves in. So this is an uphill battle if we're to really reach herd immunity. But I think it's a necessary one so that we can move forward. Thank you.
Thank you. So Dr. Seghire, would you add to that or disagree with that?
Thank you, Chairman. No, I would agree with everything that Reverend said. I think all of that is absolutely necessary. I do want to maybe stress a couple of points on top of that. So I think one good news for DC, as I mentioned, is that the percentage of skeptics, which are people who really believe in conspiracy theories, misinformation, is actually quite low, because those are in DC, those are quite hard to shift. If we solved one of the barriers, which is really about cost and time, I think that is going to solve a good chunk of the uptake issue in DC. So in addition to what Reverend said, what I would add is, how can we shift the times of the vaccination so that, they're available in the evenings, they're available on the weekends when, when people are not working. How can we use, a lot of the other mobile models to bring them close to them, do community mobile sites. So I think there's a lot of experimentation to be done in bringing the vaccine as close to the person. And as Reverend said, in using trusted figures. So I do want to stress that these access and cost barriers are perceived, and they're real from how people feel about it, and we can solve for them. Finally, I think we can also stress that this is free. Still, several people believe that this is not free. It's going to cost them. And I think we really need to emphasize this message. And then again, at this point, this is all about one-on-one. So how do we use each of us in our families and our friends to be the advocates and really think about how do we talk to our friends and family in a way that resonates with them, not in a way that antagonizes them. Thank you.
So Dr. Segar, and I'm sort of focusing on you because you're going to be leaving shortly. Cost anxiousness is one of the categories, and yet it's free. And so the issue there is that not everybody understands it's free.
Yeah, not everybody knows that this is totally free. For example, when you register at a site, they ask you for your insurance information. And so there's always this perception, well, is this going to cost me something at some point? So I don't think the message that this is totally free has gotten out as much as it needs to. On top of that, time is also cost for a lot of people, right? The ability to take time to go get vaccinated, especially if you're working on an hourly basis, that is a cost. And so how can we address that, right? And how can we make sure that we, allow people to take the vaccine and so that they don't have to pay for it in a different way through their job. So cost is an issue, and people do perceive that there could be a cost associated with the vaccine.
In your testimony, Dr. Segar, if I understood correctly, of those who have not yet taken the vaccine, the enthusiasts make up about 7%. The enthusiasts were defined as the people who, they can't wait to get the shot. So why would there be some who, what's going on?
Because most of them already got the vaccine, right? All of the people in DC that would be identified as an enthusiast based on how they relate to the vaccine are the ones that have already gotten it. So there's very little enthusiasts left yet to get the vaccine in DC. The remaining set of people that are to get the vaccine are the ones that fall into, as I mentioned, into the watchful, cost anxious, and COVID skeptics. So most of the enthusiasts were the ones that are lining up and did all that they could to get the vaccine.
Okay, so I'm still a little bit confused, and I have another question here. Why are some parents willing to vaccinate, more willing to vaccinate their children than themselves?
Good question. Let me just actually clarify your previous question so that there's no confusion. When I say 7%, I mean of those that have not received the vaccine. So this is of the unvaccinated population. So that's why you may be confused of why it's such a small number. So of those that have not gotten the vaccine yet in DC, 77% are enthusiasts. So because a lot of them already got the vaccine, they fall into the majority of that gotten the vaccine. In terms of parents, that's a very good question. I do not have data to be able to answer that question in a data-driven way. I can only speculate. So maybe I'd ask my other members of this committee to address that.
Dr. Wu?
Yes, in our studies, we actually found a very, very high correlation between mothers of their intention of self-vaccinated versus vaccination of their children. That was even before their EUA came out for the Pfizer vaccine. So in our study, we showed an extremely high correlation.
So there may be some mothers who are willing to vaccinate their children, but not themselves, but it's actually a small number.
Very small in our study.
Okay. I've been hogging the time, and Dr. Segar is going to leave shortly. Councilmember Henderson, did you have any questions on this?
I did. Thank you, Dr. Segar, for your testimony. So it seems as though there might be some overlap in terms of those who are quote unquote considered system distrusters and some of the parents that Ms. Cadogan was talking about in terms of not trusting that the school will ever be safe to send their child back. And so I'm curious, how do we get to system distrusters? Because those seem to be very overlapping groups. And one of the things I'm kind of thinking about is even if we had, a plan where children said, okay, we're going to do pop-up vaccination sites at schools, right? To try to get younger kids vaccinated, that we will still have a subset of parents who says, you're not vaccinating my child, and my child is not going back for in-person. So how do we get to those individuals that have that kind of overlap there?
Yeah, no, that's a really good question. I think there's a few things. I mean, With system distrusters, as I mentioned, they believe that people of their race and in color have been treated unfairly in the health system. So one of the things we can do is, for example, stress how in DC with data, how DC has really taken an equitable approach to the COVID response and show data that emphasizes that the inequities in DC are less so in other places. And DC has been, very at the forefront in addressing this issue, especially when it came to the COVID response. Now that's at a very macro level. At a very micro level, it really comes down to community conversation, community engagements. As Reverend said, it's really working with the leaders in those communities, having those conversations, listening, and really acknowledging, this is real. This is not, this is something we should really accept that there is a good reason for people to be distrusting, but really having those conversations and really trying to emphasize how we have and are working to move towards a place of a more equitable response and how people in their community are actually taking the vaccine. So the other thing to show is how other members of their community are actually coming forward as role models and taking the vaccine, and look, people are fine. Nothing has happened. And so unfortunately, this is hard work. At this point of the response of the COVID vaccine, this is the place where it gets harder and harder and it gets more interpersonal. And unfortunately, we all have to work together. It really rests on every single person in the community to take that role of being an advocate and a listener to their fellow community members.
Okay, because that's, I think, as you say, we're getting to sort of this harder place, which I think is actually very true. But when we look at the map of DC of who's been vaccinated or who at least has gotten one shot, and overlay that with families who feel comfortable sending their children back for in-person instruction, the areas where we have the least vaccinated are also the ones who are least likely to send their children back or feel least comfortable with that. And so I guess from a policy standpoint, we're like, but we're offering an option here that can help to ensure some safety. I know it's 1:30. So the other question I had, just in terms of your research around, I guess, vaccine hesitancy for the COVID vaccine versus vaccine hesitancy overall, right? Because I feel like there are a lot of people who are hesitant about the COVID vaccine, but are not anti-vax when it comes to, Tdap, measles, polio, those types of things. So what is the difference there? Is it just because those have been around for longer? They don't necessarily remember, or were not, I guess, adult and cognizant enough to know, of seeing the development process, whereas there's been a lot of news about the development process of this particular vaccine. Can you help there?
Sure, yeah, you're absolutely right. The typical anti-vax group that we think about, there's overlap, but they are not equal to the COVID, what we call the skeptics when it comes to the COVID vaccine. So these people may have taken other vaccines, but are skeptical for COVID, to take the COVID. I think part of it, there's a couple of things happening here. One is many of these people don't believe COVID is a threat or a risk. So when we're referring to the group that are COVID skeptics, who are people who believe in conspiracy theories. So I'm not talking about hesitancy in general, but a very particular group, which in the US makes up about 17% of the population. These are people who believe in things like, the government is using, COVID to manipulate you, or that there's a chip being implanted, et cetera. So these are very, very specific group that believes in misinformation. And again, I don't think we should belittle this group. This is an important group, right? This information they're receiving from people they trust. Some of them are political leaders, some of them are community leaders. And a lot of this information is being consumed online, where there is limited fact checking and not enough being done, and from a prevention side. So I do want to stress that. But the second point I do want to stress, which you highlighted, is the reason also why people can be skeptical and are skeptical is still about the speed at which this vaccine got approved. And I don't think we've done a good enough job to really explain, in my opinion, why this was so fast. It was not that we cut corners. This actually rests on decades of research, and that it was a lot of the red tape was cut that normally would be, taking, in terms of approving another product or a drug or a vaccine. And I truly believe we have not, when I say we collectively, have not done a good enough job to explain that to people. What is a normal vaccine approval process? What does it involve? What has been the COVID process? And where is it that we have, cut time, and why were we able to do that? So I hope that answers that question.
Yeah, that does. I have other questions, Mr. Chairman, for other members. I also have another hearing that I need to get to as well. Can I continue on? Do you mind? Or sorry, I see Councilmember Che. I don't know if she has some specific questions on this. So.
Correct. Dr. Sugair, can you stick around for a few more minutes?
Sure. Yes, I can.
Councilmember Henderson, you got 3 minutes left, and then I'll turn to Councilmember Che.
Oh, I didn't know if you wanted to turn to her now.
I'd kind of like to turn to her and then come back.
That's fine.
Okay. Councilmember Che?
I'm in such great demand. Isn't it wonderful? Yes, I have a couple of questions about the vaccine issue. One is, in addition to having, places of familiarity, relying on peers, and that sort of thing. I was wondering if there is any benefit to two things. One, to getting our businesses on board, both for providing time off and encouragement. So for example, I don't know, I'm just throwing this one out, the Restaurant Association. Could they get all of their members to say, we're going to have a vaccine pop-up at the restaurant today or whenever, and also people who get the vaccine, employees, we are quite willing to have them have the time off, including the next day, because there may be some unpleasant effects, but all of our businesses to do that, whether it be law firms or whatever. So that's number one. And number two, in a lot of these other jurisdictions, they're coming up with these schemes, to pay people, or you enter into a lottery or anything like that. Are those things at all worth it? Because given the profile of people who are not getting vaccinated, it sounds like access and resources and education about, non-payment and things of that nature. Those are the things we need to focus on. But do these other little funny things that are going on, do they help at all?
Did I answer?
Sure. If you, anybody can answer. I just put it out there.
I'm happy to get started and then call on my other members. Chairman, up to you.
Dr. Sugair, do you want to answer?
Sure. Yeah. No, thank you for that. For both of those questions, I am a very strong advocate of leveraging employers and workplace. I think that can go a long way, both small, medium, and big businesses. I completely agree with you. I think workplaces should take this on as something that, it's an important agenda for them, for their employees, and for their customers to make it all safe and for us to go back to normal, as soon as possible. So definitely giving time off, coordinating with DC Health or others to bring the vaccine to the employees. All of those work. We know they work and should be, in my opinion, leveraged, at all scales. There's a lot employers can do. And I think even, the Biden administration has recommended this and put forward strong policies in terms of encouraging employers to give time off. So definitely. On your second question, I'll just maybe touch base and ask my other colleagues to address. So incentives have been used, have been experimented in health in general, in public health for decades on a number of different programs. There are mixed results in terms of whether they work and how they work. There's a lot of variables, whether it's a fixed incentive, how big that incentive is, whether it's a lottery, how big that lottery is. So there's a lot of variables here. The one thing I can say is that incentives, one set of evidence suggests that things like fixed incentives work best when people have already decided and have the intention to get vaccinated, but there is some sort of structural barriers like time and cost, and that they really kind of solve for that kind of barrier. So, and as you know, many states across the United States are experimenting. So I do think there is there is room and opportunity to experiment with those. I think we just don't know how they're going to work in this context. But I do think they're one tool among others that could be and should be used and experimented with. Thank you.
Councilmember Choi, did you want Dr. Wu to answer as well?
Sure. I mean, I really want to know whether it's something that we should explore or not. Certainly the employer approach, I'm keen to pursue that, but also these other devices, I'll call them, strategies or something like that to get people vaccinated.
Yes, thank you. I think also I totally agree with Dr. Seeger mentioned that to leverage some of the existing infrastructure, including a workplace and regarding what we mentioned about churches and other certain incentive mechanism, I think those are all helpful. So right now, I think the question might be cost effectiveness regarding the very limited amount of the resource we have, and given the time, what should we focus the most? I think a workplace is a big one, and also I also think social media is playing an increasing big role here, and specifically with certain sub-communities. So if there is a partnership that you can find some influence, some kind of strong influencers, figures in the social media arena within DC, that might be something to explore further regarding the strategy.
Well, thank you. And then that, oh, I'm sorry, Dr. Segayer, you had some other?
I was just going to add one other tool to consider, and is since schools are opening up in the fall, is the consideration, and I think again this is really an important consideration. I'm not advocating one way or other, is whether to make vaccinations mandatory for students, especially since now the vaccine is going to be available for, it's already available for 12 to 16 and then below. We know that when making vaccinations for other for the other vaccines actually was mandatory, was one of the reasons where vaccine coverage can be very high among younger children and students. So it's just one other tool to consider for the district.
And that too is a great point. And all of this, I suppose because there are parameters in terms of money, we should really have a hierarchy of where to put our focus to get the best results. And that got me to thinking about Reverend Curry's observations about budgetary effects, so that we're going into budget now to think about whether we have an adequate budget. For example, media. That's an important point. I mean, especially younger people, they're influenced like that, and there were a lot of things people were saying for the younger people, of which I'm not one, that being able to now get out and be with their peers, and I mean, even if it was something like that, to say, we all want to get out, but get vaccinated, something, a simple message or something like that. So Reverend Curry, I thank you for your point about, focusing on the budget, and then for us to have, on the council, some kind of hierarchy of where to put our resources to get the best results. But on vaccine issues, Mr. Chairman, I don't have any further questions.
Thank you. So Dr. Segayer, if you want to excuse yourself because you had that other conflict, we appreciate your being with us.
Thank you very much, and my apologies. And if there are any further questions, happy to address them offline. Thank you so much, Councilman.
Thank you. Councilmember Choi, do you want to just finish with the clock changed, another couple minutes, and then I'll go to Councilmember Henderson, and then I'll come back.
But excuse me, I mean, you can run things as you choose, but I thought we were just doing the vaccine issue.
Yes, that's true.
Okay, so I'm done with that part of it. I do have other questions, though, many other questions about, for our other experts. So I'm happy to stop here.
All right, well then why don't we'll start the clock again in 10-minute rounds. I have some more questions. I do have a couple more questions on vaccine. Dr. Wu, are there other jurisdictions in the country that are tackling this issue well? I'm talking about overcoming the vaccine hesitancy. Mm-hmm. And what are they doing? that we should be following?
Yes, I'll be happy to discuss a little bit on that. I think in my testimony, I mentioned about the one of the examples by the Michigan HHS department. So what they have done well is that I think they have actually built on top of what they did initially. So they, at the beginning of the pandemic, there is this equity tricks that they have success, and they expanded this equity works to consider the building alliance in terms of the vaccine work, and then use this, they aim to understand the needs of our communities. And so that's our Michigan, our HHS department is that perhaps can serve as one of their example reference. And then another example is Florida's statewide COVID-19 vaccine community engagement task force. And I believe that that one was actually initiated by a pastor and not by the governor or the other political elected officials, but nonetheless, they actually consist of all parties, including Black higher education representativeness, business owners, media representative, as well as officials. And then they also are actually collaborating with the governors. So it seems to be working. So again, this speaks to this a concerted effort, because as we get to realize that there just are more and more detailed works. So if there is a structure of that kind of collaborated task force that can be in place, that will, I think that will improve their effectiveness.
Can I chime in, Chairman Mendelson, and share about some examples that I've seen, and especially around communities of color? So I think really New Mexico is a state to highlight. They're at over 70% vaccination, and actually their native communities and reservations are at some of the highest rates in the state. And the way that they did that was multifold. One, I want to give them a shout out because all of their state health directors are women. And so the way that they approach this is a really community-centered approach. And so the reservations actually started doing mobile vaccinations. They worked with, similar to what Pastor Curry is talking about with pastors, Native communities are very similar in that they have certain community elders who did a lot of the conversations to make sure that people felt comfortable with the vaccinations. But they didn't just have that you have to come to a center as we do in DC to get a vaccination. They actually did drive-throughs where people didn't have to get out their car. I want to highlight that because my brother is actually an African-American male with schizophrenia. And that was the way we were able to get him vaccinated, because being in large places with those kinds of things are oftentimes triggering for people with mental health issues. And so we were able to get him vaccinated because they were willing to let him drive up and bring the vaccination to the car. So I think with a lot of our populations of color, given some of the things that we know, these would be really helpful. And I think we do have examples of that. It's just that I think we focus so much on the individual and the individual decisions. And what we forget is that communities of color are very collective, and we approach things in a collective kind of and community-centered approach. And I don't think we've taken that same approach in order to make people feel more confident and comfortable. And then we haven't actually gone to people. We've asked people to navigate systems and to come to us. And it's the backwards way to do things. So just want to really highlight New Mexico, a population that has very high numbers of Latinos and Native Americans, and they are actually vaccinated at the highest rates in their state.
Thank you. I was going to say that's helpful what you said, Ms. Cadogan. But I was just going to finish with Dr. Wu, that basically what you were highlighting with Michigan was partnerships that came from the state, and in Florida, partnerships that came from the private sector. But in both cases, partnerships, which really isn't that much different than what Ms. Cadogan was saying. Maybe not exactly partnerships, but those more personal, easy links. I'm going to shift to talking about IT. One of the questions I have that wasn't addressed, I don't think, by Mr. Reed or by Mr. Chambers was what I'm going to call customer support. Assuming that a vast majority of our students return to in-person learning in the fall, which is roughly 50,000 students for our DC public schools, the number varies for the charter schools. How many individuals do you think are needed to handle IT issues? I guess my question gets a little bit more complicated here. If about 10%, I don't know how you get 8,500. If about 8,500 students had to continue with remote learning next year. I asked that question very poorly, but I think you understand it. How much do we need in the way of support? We talk about getting digital equipment out and very little said about some IT support. Mr. Chambers, you want to go first and then I'll ask Mr. Reed?
Yeah, I mean, if you're looking at 8,000 students learning virtually, that's a lot. And I think a lot depends on what the idea of support is. What are they there to support? You know, I believe you all had a partnership with Comcast to provide students with high-speed internet, trying to figure out what is the responsibility of Comcast and what is the responsibility of the district. If all connectivity issues are the responsibility of Comcast, that is one thing. But if not, then I suspect it is, you would need quite a large staff to be able to adequately support virtual learning for 8,500 people. My advice would be to, it's just a short term, I don't think anybody expects 8,500 students to be learning from home forever. It would be to somehow figure out how to not make troubleshooting home internet connections part of the district's responsibility and put that back on Comcast, as they have likely been engaged to, supply the routers and whatnot, and let the district IT staff focus solely on district resources, so hardware repairs or specific problems with applications. It's just a business that I don't think the district is prepared to do, nor should do on a long-term basis.
Yeah, and I would just add to that. I can't speak directly to the IT component as much as Mr. Chambers can, but from a customer support perspective, you can imagine we operate statewide virtual academies in Ohio, for example, 22,000 students in that school alone. So, and we have no issues with, no unusual issues with support in IT because we have a very robust IT department. To Mr. Chambers' point, it's very difficult for a district to do that on their own, particularly with the relatively short on-ramp time to do that. So it's important just as much as, me as a traditional teacher and principal in brick and mortar, I had to rely on a Houghton Mifflin or other organizations who did that. Similarly, if you're going virtual, I would really tap into organizations who know how to do this and not place that burden on school districts. So whether we work with 501c3 charter schools or districts, we, that entire IT support is a part of our administrative cost and service. Well, so to answer the question specifically, we operate schools under 100 to as many as 22,000, and all that customer support is a part of that.
And one thing to add too, it's not like any work's been taken off of the district IT staff during this. This is just an add-on. They still have their servers, they still have the schools to maintain, they still have the devices to deploy. I mean, no one ever wants to take work off of IT, and that's kind of the problem. Is IT is one of those things that's never done. You deploy applications, you deploy devices, then those are your devices. It's not like you deploy them and you're hands off forever. There is a lot of variable here, and I go back to kind of what I mentioned before. Based on the problems that I heard that the district had, I would venture to say you have a lot of Wi-Fi problems in the home, from routers placed on one end of the house. You got 3 or 4 students spread around the house, walls in between, just not adequate coverage. Because again, not all Wi-Fi is created equal.
And I'm out of time. I'm going to come back to this on my next round. Councilmember Henderson, do you have any questions?
I do, Mr. Chairman. I actually wanted to start with Mr. Chambers. I'm curious, based on your experience, what happened when a student had to quarantine or a teacher had to quarantine? How were schools able to accommodate that? Because that's one of my concerns, is that our kids will just be given like a worksheet packet, but you won't get actual instruction unless the school is willing to sort of go above and beyond in terms of doing simulcasting.
Yeah, that's what we did. And I guess when I said, one of the prefaces, like we had very, very low rates of COVID. We only had like one instance of community transmission among our students, and so we are thrilled to be ending the year, and just it's just been a very successful year, and we're very, very happy. We used like cameras from a company called OWL. They're like 3D cameras. And so they were placed in the middle of the classroom, and they provide like a 360-degree view of the classroom. And so when a student was virtual, we would send them like the links, like, hey, math is at 10:30, here's your Zoom link. And again, this is not a scalable approach to a district with 50,000, but you can kind of get the way we did it. And then the kids would log in. They would submit their work over Google Classroom, but we also did send some work home, but it was to be done like alongside. And it was fine. Like we had students that would, particularly last semester, were virtual most of it, and did well. I mean, everybody just kind of has to adjust. And you really were reliant on the situation on the parents, because again, we're in elementary school, so we're kind of reliant on the parents to make sure the kids were kind of getting there where they need to be, and we can't force them to log on, and that's the parent kind of has to play a role there.
Well, let me ask you this: in terms of that particular setup, did that allow for the student to actually engage in terms of like asking questions, et cetera, or only sort of watch?
No, they could talk.
Oh, okay.
We had TVs, like we had TVs in every classroom that like the students could see. They could like the teacher's computer was displayed on there, and then they were sharing the screen over Zoom, and they could see along, and then they could also see the teacher ask questions. I mean, again, like it's obviously, I mean, let's be real. No one would rather be virtual here, and I don't think anybody would argue that virtual education is the same as in person, because so much of education is the verbal cues, and a teacher being able to tell a student is not getting it and walk up beside that person and like the side conversation. You do miss that in virtual. But using the combination of Zoom, big TVs, and the OWL cameras, it worked well. And again, live instruction, I think, is key. It's not worksheet. It's not watching videos later. Live instruction is key.
Yeah. Okay. I appreciate that. I mean, I think, one of the questions I have for DCPS, and I know this is harder, Ms. Hodge, in terms of charter schools, is that some families have already been asking us in terms of, well, what's the plan if I don't want to send my kid back for in-person? Like, what is the virtual option that they have? And I think that, well, there'll be a lot of people who protest this option, but it is a lot to put on an individual school to plan out a virtual classroom environment for one or two or a handful of kids, versus the district saying, okay, yes, your child can opt into virtual, but they will be attending citywide online school with kids from all over the city, as opposed to in their individual school with the classroom teacher that you happen to like. I already know parents are going to protest that particular option, but I don't see how we scale it in another way to, as you say, I mean, you're in an elementary school setting, and I'm thinking about the size of some of our elementary schools, for them to have to put together a virtual option for a small percentage of their students versus, sort of focusing in sort of the larger pieces.
Hybrid is much harder than all virtual. Teachers focus has to come. It's just, you're not set up cognitively to do that. I mean, it is a lot to put on a teacher. I mean, when our teachers would have a kid come off quarantine in the back of the classroom, they're just like celebrating, because they know like it is massively less work, and they can focus more on their in-person students. So I would agree that if there is going to be a virtual option long-term, it has to be a situation where that teacher is virtual only and can focus just on virtual. Because again, it's just a lot to put on teacher. Let's be real, teaching is hard. It is a
Yeah.
really, really hard job. And it's like anybody that wants to say it is not, like you're fooling yourself, like it's a really, really hard job. And then to add that variable of virtual and having to see that kid, and there's just going to be cues you're going to miss up on, nonverbal cues you're just going to miss up on, particularly with just one or two virtual students.
Yeah.
Yeah,
Ms.
a
Hodge.
lot-
Oh, go ahead, Mr. Reed.
I was just going to add, so I know that wasn't directed to me, but a lot of the data from districts that have gone to virtual, the biggest complaint was from teachers was juggling both virtual and face-to-face. When we partner with districts, they have their on-site teachers deliver in face-to-face, and we have virtual teachers who provide that virtual instruction.
You have separate, not the hybrid response. I mean, I've seen a couple of classrooms, and that's just coming to Ms. Hodge. I've been to Friendship Public Charter School where, they were, I wouldn't call it piloting, but they were basically trying it out, the simulcasting of like a teacher being in person while also having kids in person and having some kids on virtual. And it just seems like a lot just in terms of like, there's this joke about teachers having eyes on the back of their heads, but like you literally have to have like eyes on the back of your head and on the side and like be able to sort of function across the whole bit here. I'm curious how some charter LEAs are thinking about this or not thinking about this. I mean, are they planning to offer a virtual option for families, or is that like a measure of last resort?
So I think that most school leaders are trying to get students back in person. And what they're hearing is that not all families are ready to come back in person. And just to be completely transparent, there is a bit of tension between what schools are seeing on the ground in terms of that reality and what mandates they have, which is to be fully in person 5 days a week with no virtual options, except for students who have medical exceptions. And that I think is troubling for a lot of schools, because right now they don't see 100% of their families wanting to return to school, which begins in the first week of August for some LEAs. So we're not talking about late September as a return to school date. One thing that we are hearing, though, is that schools do have the ability to enter into a consortium to offer classes so that it does not have to be LEA by LEA or school by school. They, though, will have to do that legwork on the ground to make those consortia work. And so we at the DC Alliance are preparing to ramp up our services to support schools in doing that. But it may be one way that schools can kind of meet that need. But I think we're still trying to figure out, and schools are still trying to figure out what happens for those 10 to 20% of whatever the number might be of parents who are not yet willing to bring their students back. And to
that's
echo
the part that I struggle with as a policymaker, because even right now, we look, charters aside, let's look at DCPS. On one side of the city is bursting at the seams of parents wanting in-person instruction. They're mad and they only get 2 days a week. They want 4 days a week, the whole nine. And on the other side, we got a bunch of empty seats. And frankly, when we talk about inequity in education and sort of the larger spectrum, knowing sort of what both Mr. Reed and Mr. Chambers are talking about around virtual instruction, not necessarily being able to give you everything that you get in person. What do we do here? So I want to respect the fact that there are some families who are not ready, but at the same time, I know that we will have a generation of kids on one side of the city that is behind if you choose to stay virtual while the rest of the city is going in person.
This goes back to the first part of the conversation, which is about getting everyone vaccinated. So we know that schools are trusted messengers, credible messengers. The conversation that we were having earlier is exactly where we need to focus our attention, and is getting everyone vaccinated. Schools are more than willing to be vaccination sites. I think there may be one charter school that currently has COVID-19 vaccinations out of 128 options, only one. And so we would love to have more vaccination happening at schools, and having school leaders and teachers, et cetera, really help enforce that in their communities. Because I think until we get to that point, it'll be very hard for us to convince 100% of families, except for those with students who have medical exceptions, to be back in person. To answer your earlier question, I think schools hope that virtual is a last resort, but looking at where we are right now, it seems like it's something that they have to consider.
Do you think for charter LEAs, and I know this is kind of a dicey topic of them being able to ask their employees, one, have you been vaccinated? And two, sort of reporting it out in the same way, like, the Senate just said, 50 out of 50 Dems and 48 out of 47, whatever on the Republican side. Is that something that you think schools will move to as a way to sort of quell some of the anxiety that families might have, just saying like 100% of our staff is vaccinated?
I think so. And some schools are doing that. They're very proud of those numbers. There isn't right now a citywide way to kind of report that out. But schools are certainly, they did that with their staff for this reason, to help build that confidence in their communities. And it's time for us as a city to take advantage of that at the next step, which is making schools vaccination sites.
Yeah, I agree with you. I think my time is up, but I know that COVID vaccine aside, we know that childhood immunizations on the regular is down. And so when we think about what it's going to take over the next few months to get all of the kids to have what is already required for you to walk into the school building done, schools setting up vaccine sites where you can just like, all right, one-stop shop, get all your vaccines and your physical, and we'll sign your childcare letter or whatever it is sort of at one time, because I think Reverend Curry was accurate when he said like time is money and time is of the essence as well in terms of like moving those things forward.
And to the point Ms. Cadogan raised earlier, I think we also have to realize that we can take options to our students and families, that it does not just have to be have them come to the school. I know I've heard of at least one mobile vaccination van that supports students, and why don't we have more doing this work, particularly at this time?
Got it. Thank you. Thank you, Mr. Chairman.
Thank you, Councilmember. Councilmember Che.
Thank you, Mr. Chairman. I have some questions that sort of transcend the lines of questioning we've had so far, though obviously interrelated. And I'm not sure who best to address this to, Ms. Hodge or Ms. Cadogan. But basically, do you have advice for us about how we should go about identifying students and providing services to students who have fallen behind over the summer through the fall? What should we be doing?
I think that's a great question. So my first part of that answer is that schools are submitting to the Office of the State Superintendent of Education, and I believe mid-July, data on assessments from the past year that will show some of that information. And in the plans that schools have to submit, and they're fairly extensive plans, they're continuous education plans, one of the questions they have to answer and explain is how are they going to serve the needs of those students who have been left most behind during this pandemic, and how are they going to accelerate learning for all students? In addition to that, also, how are they going to take care of students' non-academic and their well-being needs? In terms of policy approaches, I think you will be hearing over the course of this week a lot of very specific requests and recommendations from schools. And I would say listen to them very closely, because I think they're saying really what they need at the policy level for that. In my testimony, I highlighted some very specific needs related to facilities. And I think that part of those needs are just kind of our regular needs that happen every year, but also realizing how much schools are struggling right now to meet the public health guidance need requirements, and also to educate students safely in their buildings. And so as you are hearing from DC Health, as you're hearing from others, I think always asking the question of, have you engaged school leaders on these questions? Are you sure that schools can serve students given these set of guidelines? Because what we're finding is the more we hear, the less clear it is, and the less clear it is for school leaders. I think also we are part of a group that is supporting additional funding to go to students who are designated as at risk out of the federal dollars that are coming to DC, with some very clear requirements for schools to apply for those funds, and data reporting requirements for schools that receive those funds. But the idea there is that this is the time of all the times we've had in the last years in advocating for at-risk funding. The money is there now, and this is the time to actually dedicate those funds to those students and actually get real results for them instead of the incremental changes that we've been trying to get over the years. This is the time to make a bold investment for those students, and we certainly encourage the council to do that.
And just to piggyback on what Ms. Hodge said, I think the other components, Councilmember Che, that I think would be really important is making sure to get that data to families. I think many times we diagnose that this child is behind on reading or is having these gaps in their math skills. And we talk about that, having been on the school side, internally, right? We talk about that amongst our teams, but families don't always have that information. And we think that when we give them the specificity from the assessments that we have internally, it's too complicated. Well, it's not, right? They've literally been the people delivering school every single day inside of their households for the past year and a half. And I think if that has taught us anything, it's that we need to trust them with the information that we have as well inside of the school building so that they can also support their children. Because as we've learned from the vaccines, what would be the worst is if we diagnose and determine that the best intervention is tutoring, so let's say, and yet families don't believe in it, right? And so I think one of the things that's actually really important is to use this moment to make sure that we get that information to families. And for students, I would also say get that information to them. Many times when we start having this conversation with families, they're like, oh, well, my child is doing fine. And we start to peel the onion. We're like, oh, really? Like, I remember like pre-pandemic, they had some challenges in reading and they're like, oh, well, yeah, actually, I don't think their reading is really where it needs to be, but I actually don't know how to help them. And we have to understand that some of it too is like families have a lot of burden that they feel from this period where kids have been with them every day. And some of these like challenges around academics still persist because they're not reading instructors, right? Like we can't, I don't believe I can teach a child fluency, right? That was not what I was trained to do, but families feel like because they were with me, I should have been able to do that. And so there is also this fear that they have, right? And so we need to really make sure that we're giving them that data and then helping them to understand, here's how you can help your child at home. We've separated for so long home and school so much, and then the pandemic forced home and school to come together. And so we actually have to honor that, I think, as we move forward to make sure that we're getting the buy-in of families, both parents and students, as we do that work moving forward. So I think we always do a good job of submitting, not always, well, we have gaps, submitting plans to OSSE, right? But in addition to submitting the plans, I think we need to figure out what are those individual plans that we need to do with families and the trust that we need to build there and make sure that the same information that we have that we're submitting, they actually know about their own child.
I think that communication part of it, you know, that's been a theme of a number of the witnesses who have come. And so we have to do a better job really overall on that point. Let me just ask you, now there's perhaps an easier way to get data with respect to students who have fallen behind in their subject matter, math or what have you. How are we going to assess students? And it's not just those who have already been designated as at risk. How are we going to assess students who perhaps have lingering or byproduct emotional, social, or other deficits caused by the pandemic? How are we going to get underneath that?
I think that's a great question, and one that PAVE Parent Leaders and the Mental Health Coalition has been fighting to make sure that we actually do. But that has to start with us having the number of professionals that we need in schools in order to do those types of assessments, right? And I think what we often do is conflate a couple of professionals inside of school as being sufficient, right? Versus there's a difference. Like there are social worker needs, right? In terms of the resources that families need, because we understand part of what's going on is that there's poverty that's happening as well. If you have unstable housing, it's hard to focus on stability in school. There's also mental health professionals in terms of psychologists and school psychiatrists, right? And those components. There are counselors that need to do different levels of work and have conversations with students and let them talk about the traumas that they've gone through. There are behavior support specialists that are inside of classrooms that are helping to help students understand, like, how do I do positive behaviors and what does that look like? The SEL programs inside of curriculums need to be focused on the needs of kids. And I think one of the challenges that we've had is that oftentimes people are like, well, we put more mental health professionals in schools. Yes, but we're still not at the ratios that when you look at what those associations say we need, that we don't have them. And so we have a lot more work to do. And then we need to designate out that it's not about one or two, it's about having the whole battery of supports in order to be able to do those types of assessments and address the needs of kids.
If I can jump in here too, I think we had all agreed that we all could never be on another Zoom call and we'd be all right with it. We're all, after a year or 14 months of this, we're all kind of over it. And I think if you just think about if this group of people on the Zoom call went to lunch, we would feel much more connected emotionally. And we have none of that on Zoom. And the cognitive load for us as adults to be on Zoom calls all day, every day has taken it out of us. And you put that on a kid, it's even harder. And I think that's going to be the challenge. Like, you're never going to, with technology, replace a dedicated teacher that knows that kid, that's with that kid every day, coming in, knows if they're there or not there, knows when something's off. No amount of technology is going to change that. Just video doesn't work that way.
Well, that's an excellent point, Mr. Chambers. That intersection between how we're going to interact with the children and what we need to do about that. But I want to ask a couple of other things here. We've been talking about resources and in particular personnel. And we not only personnel that we need to enhance what we have, but we're losing personnel. I know in Ward 3, we're losing 3 long-term principals, trusted, fantastic principals. And there may be other teachers who won't be coming back as well, or other support staff as well. So I think what we need is some overall sense of, what are the positions that we need to fill? What are the positions that we need to enhance? And what will that budget look like? And I'm looking at Reverend Curry again, because he's put his finger on the main point here. This is a big budgetary item and we're moving into the budget. So, to have some sense, let's say we really want it to be a model in terms of our personnel resources. What would we have? What do we need to replace, and what would it cost? And I assume we can get some federal money for this, but also at the same time, one way to think about this is we have an immediate, 1 year, 2 year, 3, 5 year set of issues that we have to deal with. So even if we don't commit to operating monies of a certain amount, forever, we need to have I need to have some notion about what all this is going to cost and how we should pursue the finances of this. So thank you again, Reverend Curry, for underlining that point. So to the extent that you all can give us help with that, that would be really valuable, especially at this time that we're talking about the budget. So my time is up. Thank you, Mr. Chairman.
And Councilmember Che, as I heard your last statement, it was more of a statement than a question to somebody.
Yes, but it's like a request. If the people on this call can give to the committee their understanding of what a really model or even just robust set of resources that we need in terms of personnel going forward, and then we could attach some numbers to that. I have something I can work with. I can't speak in generalities when we put numbers down on the budget. So if anybody could provide that to the committee, or even if you just wanted to give it to me, I know the chairman might be interested in something like that too. So it was a question. Could you help us?
We can certainly help with some information. One thing I just want to underscore, and Councilmember Che, you kind of mentioned this in people who may be leaving from Ward 3, is that this has been a really, really difficult time for school leaders. Unlike, they don't have in their own buildings often kind of peers and colleagues who they can kind of complain with, work their way through. And a lot of them have been isolated over the past 15 months or 14 months. And we're seeing a large number of school leaders who feel like it's time to tap out. And I think that as we look at recovery, we really do have to plan for supports for the well-being of our school leaders, additional training, additional information, and some incentives just to kind of make it through another year. It's been difficult every week with a new emergency, a new decision, a new change in policy. They've been responsive to their students and families and staff. And I think now it's time to pay some attention to them.
And I hear from, I'm not going to identify anybody, but teachers and staff all the time on this theme about communication. Pre-COVID, the edicts from on high, from DCPS, without explanation or, figuring out what the day is going to look like. There's not that kind of collaboration before with the head office, but it's even more necessary that we have that going forward. And I just think we have to really commit to that because our teachers and staff, they have suffered right along with us, maybe even more. Anyway, so that
one thing if I could just add briefly, and again, I know I come at this from a slightly different perspective in that we've been doing online education for nearly 2 decades. This is not new for us, and certainly we and others in this space have a lot to be desired, right? And as a teacher, former teacher of the year myself, of an elementary underserved school communities and a product of one, nothing can replace that school community and replacing and building family and culture in a school environment. So there are families who need that no matter if virtual is available or not. But what I want to just offer too is that, there was an initial study done. I can locate it and share with the council if needed. But last year, after districts sort of quickly developed a virtual solution in light of COVID, they surveyed parents of those families versus parents who had been in virtual for a long time. Seems pretty obvious, but it was a great disparity in terms of the levels of engagement, levels of communication, levels of connectivity that families who have been a part of traditional virtual online learning experience versus what parents got when districts went virtual for a short amount of time. So it's really important that districts not just go at this as if there is not a set of best practices that exist, right? I was the very person who was like, who the hell, who goes to virtual schools? I literally, when I left brick and mortar and I came to K-12 in 2008, I went and met with the families of parents and kids to find out who went to these schools. And what I found, it was the very demographic that I was serving in brick and mortar. They just, because those schools weren't serving them well. So what we might think as, oh my God, nobody would want to go virtual. There are families who absolutely want to go virtual, even pre-COVID. So we need to learn from what those virtual online schools have done to prepare teachers, to prepare leaders. We have heads of schools who are the sole leader, talk about lonely, the sole leader in a state. So we have to be extra careful. The way we communicate with them virtually is a norm for us. We didn't skip a beat when COVID hit. So while we have a lot to be desired, there's a lot we can learn from organizations who've done this for a long time.
I think the other piece too, Councilmember Che, just speaking to your question about how to fund all these pieces, that we can send you definitely all the things that Pay Parent Leaders. I know Pastor Curry can send you what his group is looking for. I know Shannon can send you what the charters are asking for in terms of interventions. But I think the other part that's really in that includes at-risk funding, UPSFF, mental health professionals, SEL. But I think the other piece that's really critical is that the ESSER funds actually require that you engage all of your stakeholders in this process, because it's an unprecedented amount of federal dollars that we are flooding into our system, and they don't all have to be used in the next year, right? There's a lot of controversy about how long is that timeline, but it's not a one-year timeline. And so I think there is a lot of opportunity to engage with people in the right way to figure out what it is that families, students, teachers, school leaders want in order to do that work. And I think this is a real question for OSSE, to be honest. Like, they're supposed to put that plan together and submit it to the federal government by June 7th. And that is supposed to include the ways in which we're engaging. And then going down to the school level, which we have 60 something LEAs, both between DCPS and the charters, we should be doing that as well, right, at the school district level. And that's something that we actually have a PLC that's made up of DCPS's Chief of Family Engagement and 16 charter networks and all of their CEOs and EDs. And that's something we're talking about on Thursday. But I think that's really important to think about how are we engaging stakeholders in those conversations, because the only way we'll be able to build back better, as our president says, is to do all of this work together. And I just think, to your point, we haven't done communication well previously, but the best way to start in communication is to bring everyone to the table together to literally decide how we're going to invest these dollars, which are more than we've ever seen.
So it's my turn, and I'm going to go back to some specifics on IT. I don't know if this is for Mr. Reed or Mr. Chambers. The district, what the school system has done is turn to Comcast Essentials, which has a speed of 50, I guess that's megabytes per second, Mbps. I know Mr. Chambers touched on this when you have multiple kids in the same house. Is 50 megabytes per second adequate?
Yeah, I don't know if Mr. Chambers is still here. I don't see him. I'm not able to answer that question. I don't have that level of IT expertise.
Well, what does Stride do with regard to if there are multiple kids in a house?
Well, we have a waiver process, and families can submit if they have issues. A lot of what we solve, as I mentioned earlier, is computer access and paying for sort of reimbursement of that service. But smart cities or in rural areas, there's a certain level of infrastructure that has to be in place. What we've done is, that would allow them to have access, and so our computers are updated so they're not older versions that would be slowed down on that particular network. But in terms of the infrastructure, we don't have a lot. We work with National Black Caucus of State Legislators to help with their technology initiatives in terms of creating smart cities and expanding. But what we do is just make certain that if they have service, that we have technology that can be supported on that particular service.
Can I chime in? Because I think the challenge here, and I put this in my testimony in terms of the link to the Baltimore work about Comcast Essentials, the problem is not the speeds that they're reporting. It's that those speeds are not accurate. They are actually, and this goes back to what I think
What do you mean they're not accurate?
So when they tell you what the upload download speeds are, this goes back to what Brandon is mentioning, that oftentimes providers are throttling households together, especially when households live in dense housing. So they tell you you are operating off of your own Wi-Fi access and this is the speed you're getting. But oftentimes in apartment buildings, what we're finding is that they're actually putting 2 or 3 households together. And so even though that is technically the speed you should be getting, and this is what Comcast unveiled in that article, which I think was great, that Baltimore City students actually did the investigative reporting on this, is that part of what they found is that you're actually being bundled in with 2 other households. Where the problem in that lies is not just that you're bundled in with another household, it's that that other household has 2-3 kids online, as do you, as is another one. And so now you're actually having 12 people 10 to 12 people share the same Wi-Fi. It gets real slow. And this is why you then find that parents and kids don't understand why my Wi-Fi doesn't work because I have my own service. Well, oftentimes they're not actually putting enough access points and pieces inside of especially dense housing, which is where we know low income and poor people live. And so then those speeds are not accurate to actually what they're receiving. And so this is why the work that I've talked to New York City about, New York City actually started Industrial Areas Foundation, which is a huge national organizing model. They actually started doing mesh Wi-Fi access, where they were putting Wi-Fi and getting housing developers to agree to it, to put it in their housing, inside of their housing. And they were putting multiple access points and seeing great change in the types of Wi-Fi that kids were receiving. But these major providers, they're not telling us the truth in terms of what those upload download speeds are, because many times in our housing developments and our apartment buildings and dense housing, people are sharing Wi-Fi between each other. And that's why it doesn't work. And it's not just DC, it's everywhere, because that in New York is about Optimum, right? It's Comcast, it's Verizon, it's RCN. It's just a way of not having to put so much technology inside the buildings.
Ms. Cadogan, did you say there was a report out of Baltimore?
Yeah, I linked it, my update, it's not in the testimony I sent you, but I linked it in the updated one that Christina Setlow has. But it's out of Baltimore as a group of high school students that work together with BuzzFeed News, actually. And they got a few whistleblowers out of Comcast to agree that they knew that the Wi-Fi speeds aren't fast enough because that throttling is happening.
Okay, I have one last question on IT. Mr. Reed, in your testimony, you mentioned this a moment ago, you referred to economically disadvantaged students receive internet subsidies. In some states, all families are eligible to receive at least partial reimbursement for home internet. Who's paying for that, and roughly how much is this costing?
It varies based, we pay for it as Stride as a company. We pay for families who need it, we offset that cost for them. It varies. For example, in DC at Friendship Public Charter School, I think is a $10 a month amount that's provided to families to offset their cost for service. And I'm sorry, I forget the second part of your question.
Internet subsidies and partial reimbursement for home internet. Who pays and how much does it cost?
Yeah. So yeah, we pay that. And again, it varies based on state, what funding is provided. In some states, there's categorical funding that provides that for families, so it varies literally state by state.
Let me see, I'm going to ask Dan Davis this question. So there's several witnesses have testified about how the schools, in particular DCPS, doesn't do a very good job of communicating, and that an important element to improving, whether we're talking about parent engagement or willingness to get vaccinated or whatever, is there has to be better communication, build up trust. What can we do to change that? And why would it change? We've been talking about this for years and it doesn't seem to have turned the corner.
So I think a lot of times when we talk about school communication, we talk about a one-way street where schools aren't really having those hard conversations and having open dialogues. They're having these one-way conversations where we're saying, we're announcing this plan, we're going to do this, and this is how we're going to roll it out. We need your buy-in to roll this out. Versus, hey, this is a decision. We're at a crossroads. We're at a decision. Let's sit down and talk about how we want to move forward. I think it's kind of to the point Maya was making around. We have this huge amount of money coming in from ESSER. Let's all sit down. Let's have teachers, parents, families, everyone sit down and discuss how do we make this work for our school system. Then how do we have that conversation in our school buildings locally? So our neighborhoods and our neighborhood school buildings having that same conversation about what we're going to do, how would we like to see this money being rolled out, and how we'd like to see that money be affected in our school buildings. I think a solution that we've seen that's worked in the past is when we have strong communications where that shared decision model is teachers, school building leaders, LEA representatives, and families all sitting down there and sitting at the table equally. No big eyes, no big eyes, little U's. Just having an honest conversation with all the facts, all the data that's needed, and kind of all the parameters of what we can do to move forward. And I believe that is the way forward. That is the only way forward for us to rebuild the system and rebuild that trust.
Yeah, but implicit in my question, or maybe explicit, was, haven't we been talking about better communication and DCPS listening, doing a better job of listening and working with parents and students? Haven't we been talking about that for years? So why would that change now? Why are you optimistic? How can you justify that?
I think right now we're at a crossroads, and I think what we saw during the pandemic was this shift of DCPS and all LEAs meeting parents. This was the opportunity where parents were required to help students sign up for Wi-Fi, learn these platforms, learn everything that we require teachers to do, and do that at home. And now, we're at the point where we want to say, okay, we've done that already. Now we're going to return to the classroom. Let's return to this. Let's return to our default, what it was before. And I don't think parents are ready for that. I don't think parents are going to agree to that. And I think that's why we see this pushback with parents saying, you know what, and virtual learning was better for me, and I want to keep on virtual learning, and I'm going to fight for virtual learning. I believe, as we begin to, if we want to move forward and have that complete buy-in, we need to have those same conversations that we had when we had our first reopening rounds, where we had school buildings opening themselves up and saying, okay, here's the ventilators, here are the windows that got replaced, here are the new filtration systems, and showing parents and showing families that there is action behind their words, and that there can be faith in what is said. And so as we move forward now, I think parents parents rightfully so, are expecting that. We can't just move forward with the not move forward. We can't return and try to put the genie back in the bottle. The bottle, parents are expecting to have the seat at the table. They've not the seat at the table. They've always should have had the seat at the table. And now they're at the point where they can demand it, and they're going to continue to demand it. And so we, as school systems, continue to use older messaging models, they're going to receive pushback, and they'll continue to receive pushback.
My time is up. Councilmember Henderson, if you have questions.
Thank you, Mr. Chairman.
And
Sorry
this may
for
be
my-
the last round.
Not a problem. Brief departure. Redistricting committee going on. A hearing going on the other side. But I do want to come back to talk more or less in terms of like the academic recovery piece, because I feel like some of that is kind of missing. And interestingly enough, I was having a conversation this weekend with a pediatrician that was talking about developmental delays that a lot of young people are going to be facing especially in the early childhood years, but that no one is really talking about that in particular of how schools are going to transition young people, particularly in that pre-K3, pre-K4, kindergarten, first grade arena, where a lot of your learning was based on socialization. And frankly, for the last year, your socialization has been over the internet. What are your thoughts in terms of how we as a council can support LEAs and that group of young people? We obviously, as a district, we've made great strides in our pre-K programs, but I think as Maya noted, right, that's our biggest area of drops in terms of applications and getting kids to come back to school. So what should we be doing? You know, there's a lot that can happen between now and August, right? We know there's still slots available. So how can we promote getting families to enroll their children?
I'm certainly happy to get started. I think one thing that the council can do is for staff to familiarize themselves with the continuous education plan requirements that schools will have to meet. Right now, there is a document from OSSE that outlines the questions that schools will have to respond to. It's 16 pages, single-spaced, and there is significant information that schools will have to provide on how they will accelerate learning, how they will assess students' needs coming in from not having been in person for so long, how they will do that at various grade levels, and what specific strategies they will employ. And I think it's just important for people to know, although that may not be the subject of every testimony that you hear, that every school is going through that process right now, and those plans are due on June 30th.
June 30th.
June 30th. And then I think the second part of that, and to reiterate a point that Ms. Cadogan raised earlier, those plans also include how schools are going to engage their communities in those conversations. And so that it's not just kind of building a plan out of thin air, but also how they engage in school communities. The second point I'll raise, and just to reiterate something I said earlier, which is that this is the time to put the money in at-risk funding. So a lot of the populations that you're mentioning are the ones who would be captured by if funding were for students designated as at-risk were adequate. And that's both in terms of the proposal that I mentioned earlier, in terms of really making a bold investment in at-risk funding, but also just in adequately funding at-risk students at what we know they need to be funded. And you know, the schools are coming up with tremendous plans to meet students' needs. They do have an influx of federal money to support that, but it's not going to cover everything. And it's not going to last beyond the terms of the ESSER funding. And so really, if the council wants to make sure that those students' needs are met, it's an investing in at-risk.
Shannon, can I just ask a really quick follow-up, and then you can go, Maya. In terms of the continuous improvement plans, does it require for schools to sort of, I guess, set new goals for themselves, i.e. meaning like, as opposed to our fourth graders will grow 70%, like we're gonna pick some realistic targets and say like by December, we want the following to happen type deal?
That's a very good question. I myself am not familiar enough with the 16 pages of questions, but I can certainly go in and see. But I think your point is a good one in that schools will have to readjust to kind of post-COVID, what their expectations are. And maybe in both ways, right? So that maybe for the first couple of months, what you're doing is accelerating to catch up, and then you're accelerating to move beyond. What many people have said is that we don't want to go back to pre-COVID. Like we want to be better than that. And I think that the plans that schools will have to fill out are about how can schools be better than we were before COVID?
Okay, Maya.
Yeah, I think that's a great question, Councilmember Henderson. It was a question I actually posed to Secretary Cardona and one of his staff members, Ian Rosenblum, a week ago, because, you know, as we know, the American Families Plan includes a lot of funding to increase early childhood programs, specifically pre-K3 and pre-K4, because those are not required grades. And so I think part of it also starts with getting people to understand the importance of those programs, right? I think we're making an assumption that people are just going to come back, and yet we did some real serious work in order to get to the levels that we were at with 80-something% of kids participating. And so I think it's starting there. I can think of examples like Flamboyant's home visit program and APTT, where you're engaging with families directly and individually and talking to them. I think Apple Tree has a great Every Child Ready curriculum and talking about the ways in which that combines play with fluency and numeracy. But I think these conversations about the importance of the programs are critical. And I think we would be remiss if we just assume, let's open the programs back up, let's put a lot of money towards them, and if we build it, families will come. I think one of the things the pandemic should have or is seriously teaching us is that that's not true. That we actually need to do some deep engagement with folks to make sure that people understand why we value certain things at a systems level and what it means and the life outcomes for their children, because we know the long-term outcomes for kids that engage in a high quality pre-K3 and pre-K4 program. And I think we need to do that in really studied ways and make sure that we're doing individual outreach to families to get them to reengage. Like, it gives me a lot of pause to see those My School DC numbers drop so heavily as someone who helped to get the system started, right? And pre-K3 and pre-K4 was such a huge part of that. And to see those numbers drop is a really hard thing to see. And my worry is that just like many families of low-income families and families of color have been able to access childcare during the pandemic, because many of our childcare centers that serve low-income communities weren't able to remain open or continue operating. I think pre-K3 and pre-K4 will be really similar. And I think we need to do that individual outreach to folks in order to help them get there. And the good news is that if the American Families Plan soars through at some point, it will include lots of early childhood funding to be able to do that, and to do that in a really smart way.
Yeah. Well, I mean, one of the things though, like, are we behind?
Well, compared to other states,
Reverend Curry, please feel free to jump in here. Because, right, let's see, what is it? May 24th.
Yes. Are we behind talking to them? Yes, we are behind talking to them. We need to talk to them yesterday, now. And we need coordinated efforts to be able to do that. But the challenge with the coordinated efforts, we also need to train people how to do that, right? Part of what the reason the home visit program was successful inside of DCPS and many of our charters is that Flamboyant put a lot of resources towards making sure people know how to have those conversations and do those pieces. What we don't need is people just calling saying, put your child in pre-K3, pre-K4, and let me tell you why.
No, but I mean, look, so I mean, we're behind.
Yeah.
We're not that. But in some ways we do have pieces of infrastructure that are there, right? Like organizations like Mary Center is already doing home visiting programs, right? And could be layering this message on top. They need
coordination, and it needs to be a focus and something that we are specifically planning to do. And I think this is another good question for OSSI. I know Sarah Mead and her team are thinking about a lot of these pieces at OSSI, and I think we should also really find out from them about their coordination, because they're across the system, right? Because it's not just about DCPS, and it's not just about charters, and it's not even just about schools. We have early childhood programs and other partner organizations as well, and it needs to be coordinated.
Okay, Reverend Curry.
I couldn't echo anymore. Coordination. And we need to do so at breakneck speed so that we can figure out what's happening. One of the things that concerns me the most is the right hand does not know what the left hand is doing. And so when we deal with communications, we're really dealing with a system-wide communications where we need to be speaking with one another. And that's going to take some way of having an individual, a group of individuals come together and share coordination responsibility so that we can make sure that these things happen. You're right, council member, that we have pieces of infrastructure, but we need to somehow put those pieces of infrastructure together, having the right engine behind it so that we can make sure that we can move forward.
Yeah. I have a meeting with OSSI tomorrow. I'm just curious in terms of like, who's this point person, right? Because I will talk to the DME and he will say, it's up to the LEAs to sort of plan this together. Or we'll talk to OSSI and they say, well, we can't do all this work for the LEAs. They should be, doing the part in terms of getting the enrollment and recruitment pieces back up. But in some ways, I feel like all of these conversations are layered, right? At the same time, I'm talking about, come on, bring your 3-year-old. And we could also be talking about you getting the COVID vaccine. Oh, you need rental assistance? Here's the Stay DC program. Like, who is that entity that we can just like fill you up with, knowledge and sort of, it's kind of like putting 1 million social workers out there, obviously not with the social worker designation, but with all the information necessary. And I know my time is running up, and I mean, Mr. Davis, this is kind of tied to also the safe passage issue, right? Like, okay, I might want my kid to go back in person, but the bus stop now is like a shootout zone. So all the pieces. Okay, complicated. We're running late. All right, I think I have some questions for the executive on Friday. I'm done, Mr. Chairman. Thank you so much for all of you for testifying today.
Thank you, Councilmember Henderson. I think Councilmember Che dropped off. Calling Councilmember Che. I don't see her. I was pretty much done with my questions. And I think Councilmember Henderson was done with her questions. This has been helpful. And I want to thank every one of you for your time. As I'd indicated at the beginning, the Committee of the Whole is going to have 2 more hearings this week on Wednesday evening with parents east of the river and on Friday morning with the executive, which is actually representatives of different agencies. So we're going to be pressing on all this. The mayor is submitting her budget on Thursday. And so Friday's hearing, probably the executive will be talking about specifically things that they're doing with the proposed budget. They would address some of these issues. So that'll be the first that we'll be hearing from the executive. We do have the budget hearing, and I don't have those dates in front of me, although I should. But if I remember correctly, something like June 3rd is the, if I speak slowly enough, I think Christina, can you unmute yourself and tell us what the dates are?
Yes, Chairman, June 3rd is the date for the education public witness. June 8th is when the education agencies will be testifying.
Okay, and so those of you who've talked about budget probably will be coming in on June 3rd. And then we will look at it further on June 8th. So that's going to conclude this hearing. Again, I want to thank each of you for your time because you have given us over 2.5 hours of your time, and I appreciate that. This has been helpful. As I'd indicated at the beginning, the record for this hearing is open until 5 p.m. on June 11th. The time is 2:44 in the afternoon, and this roundtable is adjourned.